The ambulance hadn't even stopped rolling when the first explosion victim began to flatline inside it. Two armored Navy vehicles hit the parking lot of Harlow General Hospital with enough force to crack the asphalt, and every doctor near the entrance went rigid with shock. Nobody moved. Nobody knew what was coming through those sliding glass doors, except one person. A 32-year-old nurse in faded blue scrubs stood at the far end of the corridor, and she had already calculated exactly what equipment she would need, exactly which vein she would cut for access, and exactly how many seconds that man had left to live. Before this story goes any further, if you've never been on this channel before, hit that subscribe button right now and turn on notifications, because we drop stories like this every week, and you do not want to miss what's coming. If this one already has you hooked, tap the like button so more people can find it, and drop a comment telling me your city and your country. I genuinely want to see how far this story travels. Now, let's go. The shift started at 6 in the morning, the way all of Mara Solis' shifts started, with someone handing her a mop. It wasn't a formal assignment. There was no clipboard, no supervisor signature, no official task log entry that read, "New transition nurse reassigned to janitorial duties." It was simpler and uglier than that. It was just the way things worked on Ward C at Harlow General Hospital, in the mid-sized city of Calverton, where the nursing hierarchy operated less like a medical institution and more like a medieval court with better lighting. Senior staff claimed the good assignments. Mid-level nurses grabbed the interesting cases. And the new ones, especially the ones nobody had bothered to learn the name of yet, got whatever was left. This morning, what was left was a spill in room 114. Mara took the mop without a word. She carried it down the hall with the same straight-backed, unhurried walk she used for everything else. And she cleaned the floor outside Mr. Terence Okafor's room, while his actual care, the repositioning, the medication check, the assessment of the pressure wound developing at his left hip, went unattended because the nurse theoretically responsible for it was on her phone in the break room. Nobody asked Mara to address the wound. Nobody asked Mara anything. She had been at Harlow General for 6 weeks. 6 weeks of arriving early, staying late, completing every task handed to her without complaint, and still existing, as far as most of this staff was concerned, somewhere between a housekeeping contractor and a piece of furniture. The transition program she'd entered after separating from the military was supposed to bridge the gap between her previous service and civilian nursing, a structured 12-month track that placed veteran medical personnel in clinical environments and gave them the hours they needed toward full RN licensure. It was, on paper, a solid program. In practice, it depended entirely on where you landed. Mara had landed here. She rinsed the mop, returned it to the supply closet, then walked directly to room 114, where she knocked once and stepped inside. Terence Okafor was 71 years old, a retired Army staff sergeant, and the kind of patient who didn't complain even when he should. He was lying at an angle that told Mara immediately he hadn't been repositioned in at least 4 hours. His breakfast tray was on the far counter, untouched and cold. The call light above his bed was blinking. It had apparently been blinking long enough that no one had registered it anymore. "You hungry?" she asked. He looked at her with mild surprise, the way people do when someone walks into a room and actually sees them. "Been waiting on that tray since 7. I'll heat it." She moved to the tray first, then to his chart on the wall tablet, then to the supply drawer beside his bed. She didn't make a production of any of it. She checked his hip without announcement, just gloved up, tilted his position with the practiced ease of someone who'd done this in far worse conditions than a hospital bed, and assessed the wound with the kind of focused quiet that didn't require narration. Stage 2. Caught early enough to manage without escalation, if someone paid attention from here on out. She dressed it, repositioned him, heated the tray, and was adjusting the angle of his bed when he watched her hands and said, "You've done that before." "Dressed wounds?" "Yes." "Not like that." He studied her for a moment. "You've done that in a place where you couldn't afford to make mistakes." Mara didn't look up from what she was doing. "Eat your breakfast, Mr. Okafor. Eggs get rubbery when they cool twice." He smiled, but he didn't drop it. "Army?" "Air Force." "Medic?" She finally looked at him. Something in his expression was familiar. Not the way a patient looks at a caregiver, but the way a former soldier looks at another one. Recognition across a gap, they both know how to navigate without explaining it. "A while ago," she said. He nodded once, slowly, the way people do when they've heard enough to understand more than was actually said. "Well," he said, picking up his fork, "whoever's in charge of this floor is wasting you." Mara said nothing. She adjusted his call light so it was within reach, noted the wound assessment in his chart, which raised an automatic flag to the charge nurse because that was the correct protocol, and left. The charge nurse, a woman named Deborah Sachs, who had been at Harlow General for 14 years and wore that tenure like a second set of scrubs, stopped Mara in the hallway outside. "Did you enter a wound assessment on Okafor?" "Stage 2 pressure injury, left hip. It wasn't in his chart." "Because it wasn't your patient." The call light had been on for, "It wasn't your patient." Deborah's voice didn't rise. It didn't need to. "You're a transition trainee. You document what your supervising nurse tells you to document. You don't go into rooms that aren't assigned to you, and you don't enter clinical notes without supervision. Are we clear?" Mara held her gaze. "The wound needs daily dressing changes. I know how to manage a pressure injury." "Then it'll be in the care plan by end of shift?" Deborah's jaw tightened almost imperceptibly, the micro-expression of someone who had just been quietly cornered by someone they'd already decided to dismiss. "Go find something useful to do," she said, and walked away. Mara watched her go, then turned back to the corridor and kept moving. That was the job. That was every day. A careful navigation of a system that had already decided what she was, and a quiet refusal to become it. Not loudly, not dramatically, just by continuing to do the actual work regardless of whether anyone gave her credit for it. She had learned that particular skill in a different context. The details were different, but the shape was the same. Exist in an environment that underestimates you. Stay competent anyway. Don't waste energy explaining yourself to people who aren't listening. She had, over the past 6 weeks, developed a functional map of the hospital. Not the official one, with its color-coded signage and department directories, but the real one. The one that told her which supply closets were unlocked after hours, and which ones were always low on the things you actually needed. Which orderlies actually knew what they were doing. Which attending physicians genuinely assessed their patients, and which ones signed off on whatever the resident told them without looking up from their phones. Which nurses were coasting and which ones were exhausted. And which doctor made the whole floor tense when he walked in. Dr. Elliot Marsh was 47, the chief of the emergency department, and the kind of person who had built an identity entirely around being the most important presence in any room he entered. He wasn't incompetent. That would have been simpler, more correctable. He was actually skilled, which meant his cruelty came wrapped in just enough plausible deniability to survive every complaint filed against him. He forgot the names of people he considered beneath him. He did it deliberately, Mara suspected. It was too consistent to be genuine. He called her the trainee in front of patients. He called her sweetheart once, in front of 3 residents, and watched their faces to see who would laugh. None of them did, to their credit. But none of them said anything either. Marsh's presence on the floor was announced by the particular quality of silence that followed him, the way conversations died and people suddenly found tasks that required looking at the floor. He came around the corner at 8:42, coffee in hand, resident at his heels, and nearly walked into Mara outside the medication room. He looked at her like she was a cart someone had left in the wrong place. "Who are you?" "Mara Solis. I'm in the transition program, assigned to Ward C." "Right." He didn't register the name. "Where's the Okafor chart? I need to review." "I flagged a stage 2 wound on his left hip this morning. It wasn't previously documented." Marsh looked at his resident, a young man named Clifford Ree, who had the expression of someone constantly braced for impact, and then back at Mara. "You flagged it?" "Yes. You're a trainee. The wound was there regardless of who found it." Something moved behind his eyes. Not quite anger, not yet, but the precursor to it. The look of someone who has just been spoken to in a way that doesn't fit the role they've assigned you. "Don't enter clinical notes without your supervising nurse present," he said. "That's policy." "I followed proper protocol. The flag generates an automatic notification. I know how the system works." His voice dropped into that particular register. Not a shout, never a shout, but a compression, a controlled tightening that was somehow worse than volume. "You're new. Learn the culture before you start making documentation decisions independently. Understood?" Mara looked at him for a moment. "Understood," she said. He moved on. She watched him go, then turned back to the medication room and continued what she was doing. The morning moved the way hospital mornings always moved, in the wrong direction, simultaneously fast and slow. A current of small crises and administrative friction and human need that never fully paused. Mara took vitals, updated charts where she was permitted to, restocked supplies in 2 bays that had been running low, and assisted a second-year nurse named Priya Anand with a post-op patient in Bay 7 who was having a harder recovery than anyone had anticipated. Priya was one of the few people on the ward who addressed Mara by name, who occasionally asked her opinion on something clinical and listened when she gave it. She was also clearly operating under the assumption that speaking too loudly in Mara's defense would cost her something, so she navigated it carefully. Small courtesies, professional acknowledgement, a particular kind of quiet solidarity that didn't require explanation. "Marsh give you a hard time this morning?" Priya asked, not looking up from the IV she was adjusting. "He doesn't know my name." "He knows your name, he just doesn't use it." Priya hesitated. "He did the same thing to the last 3 trainees. 2 of them left the program." Mara handed her the flush syringe. "I'm not leaving the program." Priya glanced at her, assessing something. "What did you do before?" "Air Force." "Combat?" "Medical." Priya absorbed that. "Okay," she said, which was the civilian equivalent of "that explains the way you stand." By 11 o'clock, the morning rush was thinning, and Mara was updating supply logs in the back corridor when she heard the radio crackle at the nurse's station. She wasn't close enough to make out the full transmission, but she caught the word blast and multiple casualties, and the particular tone of the dispatcher's voice that meant it wasn't a minor incident. She stopped what she was doing and listened. The ward coordinator, a man named Gerald Purvis, who wore his lanyard like a badge of importance, came out of the station with his clipboard pressed to his chest and the look of someone who is very busy being useless. "We're getting blast trauma cases inbound," he announced to the general area. "All ER-adjacent staff to their assigned posts. Trainees are to stay clear of primary trauma bays and assist only when directly instructed." He looked at Mara when he said that last part. She said nothing. She moved to her assigned location, a secondary bay on the periphery of the ER, technically part of Ward C's overflow capacity, which meant she was technically within the zone of things happening while also technically out of the way of anything important. A perfect bureaucratic position, close enough to watch, far enough to be ignored. The ambulances started arriving at 11:19. The first 2 cases were civilians caught in the perimeter of whatever had happened. A construction blast gone wrong, from the fragments of information Mara caught in passing. Traumatic bruising, possible rib fractures, a suspected concussion. Manageable. The ER absorbed them without much visible strain. The third ambulance was different. She heard it before she saw it. The sound of the vehicle arriving at speed was normal, but then there were other sounds underneath it, the kind that didn't belong to a civilian medical response. Heavy boots on asphalt, clipped, controlled voices. Using the specific verbal compression of people trained to communicate in high-noise environments without wasting syllables. And beneath that, the particular quality of urgency that isn't panic, the urgency of people who know exactly what is wrong and exactly how much time they do not have. The doors of the ambulance opened, and 3 men came out of it. They were large, and they were moving fast, and they were in civilian clothes that fit them. The way civilian clothes always fit people who normally wear something else. Slightly wrong, slightly constrained, like a translation that loses something in the process. 2 of them were carrying the third on a stretcher, but not the way paramedics carry someone. They were carrying him the way soldiers carry someone. Weight distributed, hands placed differently, the muscle memory of a different kind of transport embedded in how they moved. The man on the stretcher was unconscious. His left side was saturated, not dripping, saturated, the difference between a leak and a failure. And his lips were the color that told Mara he'd been losing pressure for longer than the transit time could account for. Marsh was already at the bay entrance. He saw the stretcher, assessed the visible injury, and took the case because that was his function. "Bay 1, he said, "get me a trauma kit and type and cross." "He's decompensating," said the larger of the 2 men carrying the stretcher. His voice was flat and certain, not an argument, just a statement of fact. "He's been in and out since the exfil. Left thorax, probable pneumo." "I can see that," Marsh said. "He needs a chest tube." "I know what he needs." Marsh's tone sharpened. Get him in the bay and let us work. The man looked at Marsh for exactly 1 second. The look of someone rapidly calculating whether this civilian doctor was going to be adequate, and then moved toward Bay 1 without arguing, because arguing wasn't going to help the man on the stretcher, and he clearly understood that. Mara was standing at the edge of the corridor, 15 feet away, and she was watching all of it. Her assessment of the injured man had been running since the moment she first saw him. Automatic, parallel. The way breathing is parallel, not a conscious decision. Tension pneumothorax. Left-sided. Tracheal shift beginning. The chest tube Marsh was calling for was right, but the sequence was going to be wrong. He was going to waste 90 seconds setting up in a way that assumed more time than they had, and that 90 seconds was going to make the difference between a controlled procedure and a crash. She didn't say anything. She was a trainee. She had no authority here. She had been told twice this morning to stay in her lane, and those instructions had come from people who had the institutional power to end her program placement with a single email. She stood where she was and watched. Marsh moved into Bay 1. The two men followed with the stretcher. The team of 3 ER nurses went in after him. The doors were partly open. Bay 1 didn't have solid doors, just a partial partition. And from where Mara stood, she could see the edge of the monitor, the color of the numbers, the way the injured man's blood pressure was still dropping. Then the 4th man walked in through the hospital entrance. He came in differently from the others. He didn't come in fast. He came in with the contained, deliberate pace of someone who has made themselves calm, because losing calm is not an option. And that distinction between a person who is calm and a person who has chosen to be calm was something Mara had learned to read a long time ago in circumstances that had required the skill. He was tall. Mid-40s maybe, though the kind of mid-40s that comes from decades of specific physical use rather than ordinary aging. There was something damaged in his gait, a compensation in the right hip that he'd integrated so thoroughly into how he moved that you'd miss it unless you knew what to look for. His face was the face of someone who had been in a great deal of pain at various points in his life and had structured his expression around not showing it. He stopped inside the entrance and looked at the hospital, the layout, the staffing positions, the movement of personnel, with the specific kind of looking that is actually an assessment, the kind that takes in a room not as a visitor but as a tactician. Then his eyes moved through the corridor and found Mara. He stopped. Not slowed down. Stopped. Full stop. Mid-stride. The way a person stops when they see something that recalibrates everything they thought they understood about where they were. He looked at her across 15 feet of hospital corridor, and something shifted in his expression. Not recognition exactly, not at first, more like the thing that precedes recognition. The moment before a name surfaces. Mara had gone very still. She was looking at him. She knew the face. She knew the hip injury. She knew the specific way he held his left shoulder where the old shrapnel scar still pulled the muscle wrong in cold weather. She knew a great many things about this man, most of which she had not thought about in 4 years, and had deliberately not thought about in 4 years, because the life that contained those things was a life she had, with considerable effort, left behind. But here he was, standing in the lobby of Harlow General Hospital in Calverton, looking at her like she was a problem he needed to solve and a relief he hadn't expected to feel simultaneously. "Solis," he said. Not a question. She had time, in that half-second before answering, to calculate her options. They were limited. "Commander," she said. He crossed the distance between them in a way that was technically a walk but functioned as something more purposeful. He stopped 2 feet from her, and up close the look on his face was more legible, controlled, focused, but underneath it something that was almost urgency. "You're here. I work here." "Since when?" 6 weeks. He looked at her, really looked at her, the once-over of someone assessing a situation rather than a person, though in this case she was both. "My operator is in that bay. I know. I saw him come in. Can you—" He stopped. He reorganized. "What's your status here?" She held his gaze. "Trainee." Something moved behind his eyes. "Mara. That's my current status." His blood pressure has been dropping for 20— "I know," she said. "I saw him come in. I've been watching the monitor from here." He looked at the bay. He looked back at her. He was a man who had, over the course of a very specific career, learned not to waste time on the wrong options. What does he need? Your ER physician is competent, but he's going to lose another minute on setup. The tracheal deviation is already beginning and the left breath sounds are absent. She said it quietly, precisely, without drama. The decompression should have happened 90 seconds ago. Then why aren't you in there? Because I'm a trainee, she said again, and I haven't been asked. He looked at her for one more second. Then he turned toward Bay 1 and walked through the partition. Mara heard his voice, controlled, direct, no warmth in it, but no aggression either, just a man who was accustomed to having things done and who knew how to frame a request to make it non-negotiable, telling Dr. Elliot Marsh something she couldn't quite make out from where she was. Then she heard Marsh's response, "She's a trainee." Then the commander's voice again, lower, clearer through the ambient noise. "She was a combat medic for 9 years. She's managed more blast trauma than half your department combined. I need her in here now." A pause. Then Marsh, "This is my department." And then the commander very quietly, "And that's my operator. Get her in here or I make a call and we have a very different conversation in about 4 minutes. Another pause. Longer this time. "Fine." Mara was already moving before Priya, who had appeared from somewhere behind her, could say anything. She gloved up in the corridor, one smooth, practiced motion, and pushed through the partition into Bay 1. Marsh was standing at the head of the bed. He looked at her the way people look at something that has just been inserted into a situation they controlled and no longer do. The ER nurses looked at her with varying degrees of confusion and assessment. The 2 men who had carried the stretcher were pressed against the far wall. They knew better than to be in the way, but couldn't quite make themselves leave. The man on the table was named, she would later learn, Sergeant First Class Dominic Tavares. Right now, he was just the patient. 34 years old, unconscious, left thorax compromised, blood pressure at 83, systolic and falling. Mara moved to his left side. "He needs needle decompression first," she said, not to Marsh, not to anyone specifically, just stating what was true. "Then we place the tube. Doing it in reverse at this pressure is going to—" "I know the procedure," Marsh said. "Then let's start." She looked at the nearest nurse, a woman named Sandra, who had been at Harlow General for 6 years and whose competence Mara had clocked on her first week. Second intercostal space, mid-clavicular line, 14-gauge needle. Sandra looked at Marsh. A single flicker, checking authority. Then she turned to the supply cart. Marsh didn't stop her. It wasn't capitulation. It was the precise, reluctant surrender of a man who understood, in this specific moment, that the window for ego was closed. He stepped slightly to the side, which was enough. Mara worked. She worked the way she'd been trained to work in conditions considerably worse than this one. In low light, in noise, with equipment that was held together with field improvisation and personnel who were simultaneously fighting other problems. Compared to that, Bay 1 at Harlow General was a controlled environment with everything she needed within arm's reach. She moved through the procedure with the unhurried efficiency of someone who was not performing competence but simply exercising it. And the distinction was visible to anyone who knew what they were looking at. The needle decompression released with the rush of trapped air that told her she'd been right. Tension pneumo, exactly as she'd assessed from the corridor. Tavares's oxygen saturation, which had been sitting at 81 and declining, began to climb. She called for the chest tube setup. Sandra had it ready. Mara placed it with the precision of someone who had done this in the back of a moving vehicle, in the dark, with less than ideal tools, and the tube seated cleanly on the first attempt. By the time the monitor registered a blood pressure of 106 systolic, the room had gone quiet in a specific way. Not the quiet of a crisis resolved, or not only that. The quiet of a recalibration, of people recategorizing what they were looking at. The commander was standing in the doorway. He was looking at Mara. She didn't look back at him. She was watching Tavares's color return, monitoring the drainage from the tube, running the next set of assessments in sequence the way you do when a patient is stable but not safe. Then the commander said, quietly enough that only the people closest to him heard, "There she is." And Sandra, who was right next to Mara and had heard it clearly, looked up from the supply tray and then looked at Mara. Really looked, with an expression that was trying to reconcile the woman she'd been handing mops for 6 weeks with the one who had just done what she'd just watched her do. Mara was checking Tavares's pupils. His pressure's holding, she said to the room. He's going to need imaging. I want to rule out internal bleeding before we move him, and whoever's managing his fluids needs to watch the rate. You're at risk of overcorrecting. Marsh looked at her. His face was a carefully maintained neutral, the face of someone with a great deal of professional identity invested in being the authority in this room, now standing in a room where that authority had just been quietly and completely redistributed. He said nothing, which was, Mara thought, probably the most honest thing he'd communicated all morning. Outside the bay, through the partition, she could hear the hospital continuing, phones, footsteps, the ambient noise of a facility that did not pause for any individual moment within it. In here, the monitor showed Tavares's vitals stabilizing, the numbers climbing towards safe. She hadn't asked for this moment. She hadn't engineered it or sought it out. She had simply stood in a corridor and done her assessment and told the truth when someone who mattered enough to force the door had asked her for it. The commander hadn't moved from the doorway. When she finally looked up from the monitor and met his eyes, there was a weight in his expression she recognized. Not gratitude exactly, because gratitude was too small a word for what it meant to watch someone keep your person alive. Something larger. Something that had history in it. He opened his mouth. Before he could speak, his phone rang. He looked at the screen, looked at Mara, looked at Tavares on the table. "I need to take this," he said. "And then you and I are going to have a conversation." He stepped back into the corridor. Mara turned back to the patient. Behind her, she heard Sandra say, very quietly, to no one in particular, "Who is she?" And from the other side of the room, from one of the men who had carried Tavares in, equally quiet, "You're not going to believe it when you find out." The man's name, Mara learned over the next 40 minutes, was Corporal Reed Voss, and he had been carrying Tavares since before the ambulance. Through 2 blocks of street on foot after the vehicle they'd been in became non-functional, which was a word choice that told her more about what had actually happened than any official report would likely confirm. Voss was the one who had said, "You're not going to believe it when you find out." He was standing outside Bay 1 now, in the corridor, arms crossed, watching through the partition with the expression of a man who has delivered his person to safety and does not know what to do with his hands now that they're empty. He was maybe 26, with a jaw that looked like it had been hit more than once, and had healed imperfectly, and eyes that were tracking Tavares through the glass with an intensity that had nothing professional left in it. Mara came out of the bay to update the chart in the hallway terminal, and he was right there, 3 feet away, and he said without preamble, "Is he going to make it?" "His pressure is stable, the tube's draining well." She kept her eyes on the screen. "He lost a significant amount before he got here. Imaging will tell us more." "But he's not dying," she paused in her typing. "Not right now." Voss exhaled, a long, controlled breath that had clearly been waiting to happen for some time. He nodded. He didn't say thank you, and she didn't expect him to, because that wasn't the vernacular, and he'd clearly sized her up correctly on that front. 14 months, he said. "We've been working together 14 months. She didn't respond to that, because there was nothing to respond to that wasn't either inadequate or intrusive. She finished the chart entry and moved to the next one. He watched her for a moment. "You were Air Force?" "Yes." The commander said... He stopped himself, recalibrated. "He said he'd tell you himself." "Okay." A pause. "You don't seem surprised he's here." Mara considered the question, which was a more complicated one than it looked. "I'm surprised," she said. "I just don't show it the same way most people do." Voss looked at her with something that was almost the beginning of a smile. "Yeah," he said. "He told us that too." She didn't ask what else the commander had told them. She capped the tablet and moved back down the corridor toward the Ward C station, because Terence Okafor's next medication window was in 11 minutes and she had not yet confirmed whether Deborah Sachs had added the wound care protocol to his plan. She hadn't. Mara added it herself, under her own login, with the supervising nurse field populated with Sachs's name, which was technically correct since Sachs was technically her supervisor, regardless of whether Sachs had technically done anything to earn the entry. Then she pulled Okafor's meds from the dispensing cabinet and headed to his room. He was awake. He'd been awake, she suspected, for most of the morning. The kind of patient who sleeps lightly in hospitals, because he knows from experience that hospitals are not safe places to sleep deeply. He looked up when she came in and registered the slight change in her bearing without commenting on it directly. Busy morning, he said. Some. She checked his arm for the IV site, which was beginning to show early signs of irritation at the insertion point. She made a note. I need to move this line before end of shift. Fine by me. He watched her prepare the medication. I heard something going on down there. Sounded serious. Blast trauma case. He's stable. You handle it? She glanced at him. The ER team handled it. He made a sound that communicated he didn't entirely believe that characterization, but wasn't going to push it. She administered his medication, checked his vitals, noted that his temperature had come down slightly from the low-grade elevation in his morning chart. Probably nothing, but worth watching. My son's Air Force, Okafor said. What branch? Maintenance, Kadena, in Japan. He wanted to go medical, actually, when he was younger. A pause. Talked himself out of it. Said he couldn't handle watching people suffer. It's not really about handling it, Mara said, more to the IV line than to him. Nobody handles it. You just keep doing the job anyway. He was quiet for a moment. That's what he should have heard, he said. Someone should have told him that. She finished what she was doing and straightened. She was about to leave when he said, The man you were talking to in the hallway, the one with the limp. She stopped. He came around the corner and looked at you like... Okafor paused, searching for the right word. Like he was looking for you specifically, and then when he saw you, he stopped like he'd found what he was looking for. Mara looked at the wall for a moment. I should let you rest. I'm not tired. But he said it gently, without pressure. I'm not asking you to explain anything. I've been around long enough to know when someone's carrying something they haven't put down yet. She turned back to him. I was watching her with the specific patience of a man in his 70s who has sat with enough difficult things to know that some of them take time to surface, and there's no use forcing them. I left a life, she said. I thought I left it behind. Turns out it found a forwarding address. He nodded slowly. That happened a lot? First time it's walked through the front door. How do you feel about that? She thought about it, genuinely thought about it, which was not something she did often with questions like that, because questions like that were usually asked by people who wanted a specific kind of answer, and she wasn't generally in the business of providing it. I don't know yet, she said. Okafor nodded like that was the most honest thing he'd heard all day, which it probably was. Let me know when you do, he said. I'll be here. She left him to his rest and went back to the ward. The commander was waiting for her at the end of the hall. He was off his phone. He was standing in the way he stood when he was containing something. Weight slightly forward, shoulders set, the posture of someone who has made a decision and is now prepared to execute it. He had a cup of hospital coffee in his hand that he wasn't drinking, which meant someone had given it to him, and he'd taken it because refusing small courtesies when you need a room's cooperation was counterproductive. Walk with me, he said. It wasn't a request. It was also not, technically, an order, because he had no authority here, a fact both of them understood and neither of them commented on. They walked to the far end of the corridor, past the supply room, into the alcove by the stairwell where the foot traffic dropped to nothing. He set the coffee on the windowsill. He looked at her. Commander Nathaniel Graves, he said, which was not an introduction so much as a confirmation, the name placing itself between them, acknowledging that she had known who he was and that he knew she'd known. I know who you are, she said. I know you do. He looked out the window. The parking lot was still partially occupied by the Navy vehicles, and from this angle she could see two more men she hadn't noticed before, standing by the vehicles, not quite at attention, not quite at ease. I didn't know you were here. I want to be clear about that. This wasn't... He stopped. We came in with Tavares because this was the nearest trauma-capable facility. I didn't know until I walked in. Okay. You don't believe me. I didn't say that. He looked at her sideways. You don't believe me. I believe that you didn't coordinate it. I'm still working through whether I believe it's a coincidence. Life does that sometimes. Life does that sometimes, she agreed without any particular inflection. A pause stretched between them. Not uncomfortable exactly, but dense. Graves was the kind of person who didn't feel the need to fill silence, which was something she'd always respected about him, and which also made him difficult to outmaneuver. Not that she was trying to. You're in a transition program, he said. Yes. How long? 6 months left. And then? Full RN licensure. Outpatient clinic, probably. Somewhere quiet. He looked at her with an expression that said what he didn't say, which was that somewhere quiet was a description that did not fit her and that they both knew it. She looked back at him with an expression that said she was aware of his opinion and had her own, and his didn't overrule hers. The unit, he started. No, you didn't let me finish. You were going to tell me the unit has a medical opening, or that there's a consulting position, or that someone specifically asked about me. She said it without heat. I know how this goes, Commander. I've had this conversation before. Not with me, you haven't. No, she said. Not with you. He was quiet for a moment. When he spoke again, something in his voice had changed. A shift in register, from the controlled professional to something slightly less armored. The guy in Bay 1, he said. Dominic Tavares. You don't know him? No. He came in under me 6 years ago, youngest in the unit by 3 years. A pause. He's got a daughter, 7 years old. He keeps her picture in his kit. Mara looked at the windowsill, at the untouched coffee. I know what you're doing, she said. I know you know. I'm doing it anyway because it's true. He picked up the coffee finally, looked at it. You want quiet. I understand that. I actually understand that, and I'm not going to tell you that you owe anyone anything, because you've already given more than most people give in 3 lifetimes. He set the coffee back down. I'm just saying that whatever made you walk away from it, you didn't walk away from the part that matters. You couldn't. I watched you in there, and you couldn't. The stairwell door opened and a hospital porter came through with an empty cart, glanced at them, kept going. The moment stretched and then reorganized itself. I need to get back to my patients, Mara said. He nodded. One more thing. She waited. When I came in and asked Marsh to let you work, he's going to have a problem with that. You know that. I know that. He's the kind of man who, I know what kind of man he is. She said it quietly. I've been working next to him for 6 weeks. Graves looked at her with something that was complex and brief and then gone, replaced by the controlled expression he'd been wearing when she first saw him in the lobby. Okay, he said. She went back to the ward. She expected the blowback to come at the end of the shift. She'd miscalculated the timeline by about 4 hours. It came at 2:15 in the afternoon, in the form of Deborah Sachs appearing at the nurse's station while Mara was updating intake paperwork, setting a printed incident form on the counter in front of her without saying anything, and waiting. Mara looked at the form. It was a formal documentation of an unauthorized clinical intervention. Her name was in the subject field. Marsh's name was in the reporting field. The incident described was her performance of a chest decompression procedure in Bay 1 without appropriate supervision or authorization. I was asked into the bay by the attending, Mara said. You were asked by a non-hospital personnel to enter the bay. Dr. Marsh did not issue that invitation. Dr. Marsh didn't stop me either. That's not how this works. Sachs's voice was flat and certain in the way of someone who has rehearsed this. You're a trainee under a supervised program. Any unsupervised clinical procedure is a violation of your program agreement. This goes to the program coordinator. There was a patient crashing and a licensed physician in the room. Mara looked at her. He was going to lose him. That is not your determination to make. With respect, it isn't. Sachs's voice didn't rise, but something behind her eyes did, briefly. I'm not saying this to be cruel. I'm saying it because you are in a program with specific rules, and those rules exist for reasons. Trainees do not perform independent clinical procedures. That is not ambiguous. A man is alive because sign the form acknowledging receipt. Mara looked at the form. She looked at Sachs. She picked up the pen and signed it, because arguing with someone who has already made a decision doesn't change the decision. It just costs you credibility. Sachs took the form. The coordinator will be in contact. She left. Mara stood at the station for a moment, then went back to her paperwork. Priya materialized beside her approximately 30 seconds later. I heard, she said, keeping her voice low. It's fine. It's not fine. You saved that man's life and they're filing an incident report. It's procedurally correct. Mara turned a page. I technically violated my supervision terms because someone was dying. That's going to be my argument, yes. Priya stared at her. How are you this calm? Mara considered the question. Practice, she said. The afternoon moved. Tavares was transferred to imaging and then to a monitored recovery bay on the second floor, which meant he was out of the ER and into the system, which meant Mara had no clinical reason to be anywhere near him. She stayed on Ward C. She did her job. She repositioned Okafor, updated 2 other patients' care plans, assisted in a wound closure on a walk-in case that Priya was managing, and spent 40 minutes in the supply room doing an inventory audit that nobody had asked her to do, but that clearly needed doing. At 4 o'clock, Graves appeared at the Ward C entrance. He didn't come in. He stood at the threshold and looked at her across the station. She walked over. Tavares's imaging came back, he said. Clean. No internal bleeding. He's asking for water and complaining about the IV placement, which means he's fine. A pause. The surgeon said the tube placement was... Another pause. Precise was the word he used. Good. Marcia's people filed paperwork. I know. I signed the receipt 2 hours ago. Graves looked at her. Something crossed his face that was somewhere between anger and something colder than anger. I'll make a call. Don't. Don't. She said it without raising her voice. If you make a call, it looks like I needed rescue. And I don't need rescue. I need to fight this on the merits, inside the process, the same way everyone else does. She held his gaze. I know how this looks. I've been invisible here for 6 weeks, and the minute someone with rank validates me, suddenly the paperwork appears. I understand what that means. But me winning because a Navy commander picked up the phone is not winning. He was quiet. I have to do this myself, she said. Even if the process isn't fair? Especially then. He looked at her for a long moment, then, you haven't changed. I've changed plenty. Not where it counts. She didn't have a response to that, or at least not one she was going to give him. How long are you in Calverton? That depends on Tavares, at least 72 hours. He paused. I'll be around. I know. He left. She went back to the station. At 4:47, she received an email from Program Coordinator Helen Pfeiffer, requesting a meeting the following morning at 8 a.m. in the administrative wing. The tone of the email was carefully neutral in the way of someone who has received a complaint and is not yet sure how seriously to take it. Mara read it twice, saved it, and went to check on Okafor. He was sitting up slightly, looking better than he had that morning. His color was better. The fever, such as it was, had not returned. You look like something landed on you, he said when she came in. Long afternoon. Sit down for a second. I have... Sit. She sat. In the chair by the window, with the late afternoon light coming through at a low angle and Okafor watching her from the bed with the specific patience she was beginning to associate with him. Outside the parking lot. One of the Navy vehicles was still there. The other one had gone. The man with the limp came back, Okafor said. He told me. He stood at the end of the hall for a while, just stood there. A pause. What did he say to you? That I haven't changed. Okafor was quiet. Is that a good thing? I genuinely don't know. He nodded. He looked at the window. My wife, he said, used to say I was the same man at 65 that I was at 22. She said it differently at different times. Sometimes like it was the best thing about me. Sometimes like it was the thing that drove her half out of her mind. He paused. She was right both times. Mara looked at the window with him. She still around? Past 4 years back. He said it without the particular collapse that people sometimes have around recent grief. This was older, integrated. 41 years. You get used to it, and you don't. She sat with that for a moment. I'm sorry. Don't be. 41 years is a good long time. He shifted slightly. You got someone like that? No? No one waiting for you somewhere? No. She said it without self-pity, just as a fact. I was good at the job. I was not good at the other things. Other things meaning? Staying, being reachable. A pause. Not disappearing on people. Okafor was quiet for a moment. Is that why you left? The military? The question landed differently than she'd expected it to. She turned it over for a moment before answering, which she didn't always do, and which told her something about how the day had shifted things in ways she hadn't fully tracked yet. Partly, she said. Partly I left because I kept watching the same sequence play out and I couldn't fix it from inside. People making decisions over the heads of the people closest to the problem. Command calling the wrong call, and the people on the ground knowing it was wrong and doing it anyway, because that's the structure. And here it's different? She looked at him. He had the faint ghost of something that wasn't quite a smile. Here, she said, a man in a suit tells me to mop the floor. He did smile then. Trade one set of nonsense for another. More or less. And you stayed anyway. I stay at things, she said. That's the one thing I'm consistent about. He looked at her with an expression she couldn't quite categorize. Not pity, not admiration exactly, something more considered than either. Then stay at this one, he said. Don't let them talk you into leaving before you're ready. She looked at him. Are you telling me to fight the paperwork? I'm an old man in a hospital bed. I'm telling you whatever I think will keep you from making a decision you'll regret because someone with a title made you feel like you didn't belong. He settled back against his pillow. You belong more than any of them. You just got here by a different route. She sat with that for a moment, then she stood. Get some rest. I'll try. He closed his eyes. Check in tomorrow? Yeah. She was at the door when he said, without opening his eyes, You saved somebody today, Mara. She stopped. Whatever they say about the paperwork, whatever that meeting is in the morning, you walked into that room and you saved a man who has a daughter. That's not nothing. She stood at the door with her hand on the frame and didn't say anything because there wasn't anything to say that didn't feel like less than what he'd just given her. She went back to the floor. The shift ended at 6. She changed out of her scrubs in the locker room while 2 other nurses talked around her about something that had nothing to do with anything that had happened that day, which was fine. She pulled on her jacket. She packed her bag. She sat on the bench for a moment with her phone in her hand. She had one unread text. From a number she didn't have saved but recognized. Room 214, 10 minutes if you have them. Not in order. She looked at the text for a long time. Graves was in room 214, which meant Tavares had been placed in 214, which meant Graves was sitting with his operator, the way you sit with someone when you've almost lost them, and the almost is still sitting in your chest like a splinter you can't reach. She put her phone in her pocket. She picked up her bag. She went upstairs. Room 214 was at the end of the second-floor hall, in the quieter wing where the monitored recovery bays were. She could see the light under the door before she reached it. She knocked once and went in. Tavares was awake. He looked considerably better than he had on the table. The color was back, the eyes were tracking. There was a cup of water on the tray beside him that had been partially consumed, which was good. He had an oxygen cannula under his nose and an IV in his right arm, and the particular expression of a man who is embarrassed to be in a bed with people watching him be in a bed. Graves was in the chair by the window, jacket off, in the same position she suspected he'd been in for the past hour or more. There was a third person in the room that she hadn't expected. He was sitting on the far side of the bed, in another chair, and he was an older man, early 50s, compact, with the specific kind of stillness that read differently than Graves's stillness. Not controlled exactly. More like something that had settled. He had reading glasses pushed up on his forehead and a tablet in his lap that he wasn't looking at. And when Mara walked in, he looked up at her with an expression she'd seen before in a particular category of situation. The look of someone who already knows who you are and has been waiting to be in the same room with you. Graves stood. Mara, this is... I know who she is, the man said. His voice was quiet and even, and it landed in the room with a weight that didn't match his size or his posture. He stood. He extended his hand. Captain Leonard Duval, JAG Corps, retired. A pause, brief and precise. Though not as retired as I intended to be. Mara shook his hand. She looked at Graves. You said you wouldn't make a call. I didn't make a call, Graves said. Leonard was already here. Why? Duval answered for himself. Because 6 weeks ago, he said, someone put in a complaint with the Military Transition Oversight Office about the way this program was being administered at Harlow General, specifically about a pattern of trainee reassignment to non-clinical duties and a culture of systematic dismissal of veteran medical personnel. He tilted his head slightly. The complaint wasn't yours, but your name was mentioned. Mara was very still. Someone in this hospital, Duval continued, has been watching what happens to veteran nurses who come through this program, and they've been documenting it for a while. He paused. I've been here for 3 days. I was here before Commander Graves arrived, before Sergeant Tavares came through that door. He looked at her steadily. Today's incident report, the one filed by Dr. Marsh, is the third in 14 months against a veteran trainee in this ward. The previous two were used to push them out of the program. The room was quiet. Tavares from the bed said nothing, but his eyes were on Mara. Graves was watching her with the expression of someone who has set something in motion and is now simply observing what it does. She looked at Duval. "Who filed the complaint?" she said. Duval held her gaze. "That's what I'm here to find out," he said. "But I'll tell you this. Whoever it was, they knew enough about military medical training to know exactly what was being wasted in this building." He paused. "And they knew your name specifically." Outside in the corridor, a door opened and closed. Footsteps passed. Normal hospital sounds, entirely unremarkable, entirely unaware of what was shifting in room 214. Mara thought about a man in his 70s in a bed on the floor below, with his eyes closed, telling her to stay. She thought about the chart entry she'd flagged that morning. The wound no one had documented. The call light that had been blinking for no one. She thought about the specific weight of being somewhere for 6 weeks and being so thoroughly dismissed that when you finally did something undeniable, the response was paperwork. "The meeting tomorrow," she said. "Pfeiffer." "I'll be there," Duval said. I'm not there for you specifically. I'm there because the Oversight Office has standing in any program review meeting. It's procedural." He said it without any particular emphasis. "What you do in that room is entirely your own." She looked at him. She looked at Graves. She looked at Tavares, who was watching her from the bed with the particular alertness of someone tracking a situation they don't fully have context for but whose instincts are telling them it matters. Her phone buzzed in her pocket. She pulled it out. A hospital number. Ward C. She answered. "Solis." The voice on the other end was Sandra, from the ER. Sandra's voice was tight in a way that was not its usual register. "I'm sorry to call you off shift," Sandra said. "I looked up your extension and they gave me your cell. A brief pause. "It's Mr. Okafor. He coded 15 minutes ago. They brought him back, but he's in ICU now, and he..." Another pause. "He was asking for you, before he went under. He said your name." Mara was already moving toward the door. She was down the stairwell before the call ended. Not running. Hospitals weren't places you ran unless something was actively on fire, because running communicated panic to everyone you passed, and panic was contagious in ways that killed people. But moving at the compressed, purposeful pace that looked like a fast walk and functioned as something else entirely. She took the stairs 2 at a time, pushed through the second-floor door, cut across the junction toward the ICU wing on the hospital's east side. Sandra had said coded 15 minutes ago. Brought back. Asking for her. The ICU at Harlow General was a 12-bed unit behind a pair of security doors that required badge access. Mara badged through on her employee credentials, still active, because the incident report hadn't yet generated a suspension, which meant she still had a window, and pushed into the unit. The charge nurse at the ICU desk was a man named Rogelio Fanta, compact and efficient, who looked up when she came in and processed her presence with the rapid triage that ICU nurses develop out of necessity. "Okafor," she said. "I got a call." "Bay 6. He was already standing. "You're his nurse from Ward C?" "Yes." "He's stable but marginal. V-fib arrest about 22 minutes ago. We got him back in 4. He's in sinus now, but the rhythms are regular." He was walking with her as he said it. "Cardiologist is on her way in. He's got a history of paroxysmal atrial fibrillation. It's in his chart. But the episode tonight was worse than his baseline. He had a low-grade fever this afternoon. It was coming down. It came back up, 38.8 when they brought him in." Rogelio glanced at her. "You flagged a wound this morning." "Stage 2, left hip. Care plan wasn't implemented until this afternoon." A pause. "Okay," he said, which was not okay at all, but was the word people used in hospitals when they meant "I understand the implication, and I'm not going to say it out loud in a corridor." Bay 6 had a glass wall. Through it she could see Okafor, connected now to a cardiac monitor, oxygen mask on, an arterial line in his left wrist that hadn't been there this afternoon. He looked smaller than he had in his room. That was the thing about intensive care. The equipment dwarfed people, made them look fragile in ways that the person themselves might not actually be. His eyes were open. She pushed through the bay door and he tracked her immediately, eyes moving to her the second she came through, with the focused clarity of someone who has just been through something significant and is still running the cognitive inventory of what remains. "Hey," she said. She moved to the bedside. She checked his monitor from habit, then looked at him directly. "You scared me." "Wasn't planning on it." His voice was rougher than it had been, the oxygen mask sitting just below his chin where he'd pushed it down. She reached over and repositioned it gently without comment. "They're going to make me keep that on, aren't they?" "Yes." He absorbed that. "Called for you," he said. "Before it—" He stopped. "Before the thing happened." "I know. I came as soon as Sandra called." He was quiet for a moment. The monitor blipped steadily, the rhythm irregular but present, the kind of cardiac pattern that required watching rather than immediate intervention. His oxygen sat at 93, which was acceptable but not comfortable. "I was thinking about my wife," he said. "That's the honest truth. I was lying there and I was thinking about Margaret, and I thought—" He paused. "I thought, if this is the night, I don't want to go without someone in the room who actually knows what's happening." He looked at her. "Not medically. I know you understand it medically. I mean, someone who sees things the way they are." Mara stood at his bedside and didn't say anything for a moment, because the thing he'd just said didn't require a response so much as it required acknowledgement of its weight. "I'm here," she said. "Good." He closed his eyes briefly. "Good." Rogelio appeared at the bay door. "Dr. Ewan is 15 minutes out. She wants a 12 lead and updated electrolytes before she arrives." "I'll stay," Mara said. Rogelio looked at her with the expression of someone running a quick calculation about authorization. She was technically off shift, technically under an incident report, technically without clinical authority over this patient. He was also, she suspected, the kind of nurse who knew what mattered more than protocol in a given moment. "I'll be at the desk," he said, and left. She pulled the ECG card over. She placed the leads with the practiced efficiency of someone who had done this in conditions where the patient wasn't in a bed, who had done it in moving vehicles and on the ground, and in places where attaching a 12 lead was an act of extraordinary optimism about what came next. Okafor lay still and let her work. The strip printed. She looked at it. The rhythm was atrial fibrillation with a controlled ventricular rate. Not the worst thing, given what it had been 20 minutes ago. There was some ST segment flattening in the lateral leads that she didn't like, but it wasn't acute elevation, and the clinical context was cardiac arrhythmia rather than infarct. Dr. Yuen would make the call. Mara's job right now was to make sure the information was complete and accurate when Yuen arrived. She entered the strip into his chart. She updated the vitals. She checked the arterial line site for positioning and found it acceptable. She pulled a chair to the bedside and sat. "Tell me about Margaret," she said. Okafor opened his eyes. He looked at her with a kind of surprised gratitude that was almost painful to look at directly, the expression of someone who expected to be managed rather than accompanied. "You want to hear about my wife?" "If you wanted to talk about her." He was quiet for a moment. Then he did. He talked about Margaret Okafor, who had been a high school biology teacher for 33 years and had never once, in 4 decades, let him get away with self-pity, who had a laugh that was entirely too loud for the places she laughed at and had simply never cared, who had made the best jollof rice in the county and had died of pancreatic cancer in 11 weeks flat from diagnosis to end, which was the cruelest possible timeline, the kind that didn't allow for adjustment. He talked without much structure, the way people talk about someone they've known long enough that the stories don't need context, and Mara listened with the specific quality of attention that was one of the few things she was genuinely good at outside of clinical work, the attention that didn't calculate a response while the other person was still speaking. Dr. Ewan arrived at 6:41. She was a small woman in her late 40s, moving with the compressed energy of someone who had gotten off another call to come here and had her own momentum. She assessed the room in seconds, Okafor, the monitor, Mara, the chart on the wall tablet, and said, "You're his ward nurse?" "Transition trainee assigned to his ward. Yes, I'm off shift." "You ran the 12 lead?" "Yes." Ewan was already at the monitor, reviewing the strip. She didn't comment on Mara's status or lack thereof. She pulled up the electrolytes that had just resulted and made a sound that was not quite satisfaction. "Potassium is low. 3-1. She turned to the bay door. Rogelio. Potassium replacement. IV. 40 milliequivalents over 4 hours. And I want to repeat troponin in 3 hours. She turned back to the chart. She looked at the wound documentation. She looked at the fever progression. She looked at Mara. The wound was flagged this morning. Yes. Care plan implementation was delayed. It wasn't a question. Mara answered it anyway. Until mid-afternoon. Ewan's face did something brief and controlled. All right, she said. She went to Okafor's bedside. Her manner at the bedside was different from her manner doing everything else. Quieter, more deliberate. The practiced softness of a cardiologist who has learned that a calm patient has better outcomes. Mr. Okafor, I'm Dr. Ewan. How are you feeling right now? Like I'd rather be somewhere else, he said. That's reasonable. I'm going to keep you here overnight for monitoring. We'll get your potassium up and watch the rhythm. If it's stable by morning, we'll talk about next steps. She paused. Is there family I should contact? My son. He's in Japan. A pause. Don't call him tonight. He'll panic and there's nothing he can do from there. Yuen looked at him for a moment. I'll note that in the chart, but if anything changes significantly, we may need to reach him regardless. Fair enough. Yuen straightened. She looked at Mara. I've read the morning flag. I'm adding a formal note about the wound care delay and its potential contribution to the fever and cardiac stress. That will go into his record. A pause. That's the correct thing to do clinically. I agree, Mara said. Yuen held her gaze for a moment, the look of a physician who has just assessed something that isn't on any chart. Stay as long as he needs you, she said, and left. Mara sat back down. Okafor's eyes were half closed. She's direct, he said. She's good. Like you. Mara didn't answer that. She watched the monitor. The rhythm held. Irregular but present. She stayed until 8:15 when Okafor's eyes had been closed for 20 minutes and his breathing had settled into the slower pattern of genuine sleep, rather than the shallow managed breathing of someone holding themselves together. She watched the monitor for another 10 minutes after that, noting that the rhythm, while still irregular, had not deteriorated. The potassium replacement was running. The troponin would result in the morning. She got up quietly and left the bay. In the corridor outside the ICU, she stood for a moment and breathed. The kind of breathing that has nothing to do with oxygen saturation and everything to do with the pressure of a day that had started with a mop and arrived here, at an old man's heart monitor, at an incident report, at a retired JAG officer in a room with a wounded soldier, at the specific sensation of a life she thought she'd finished with pulling at the edges of the one she was trying to build. Her phone lit up. Graves. She let it ring. Then she answered. How is he said. Stable, cardiac event brought back, he's sleeping. A pause. You okay? Yes? That pause before yes is doing a lot of work. She looked at the ceiling of the corridor. The meeting's at 8 tomorrow. I know. Duval will be there. He'll be there regardless of what you say. Oversight has standing. I know. She started walking. I want to review his documentation before then. The pattern he mentioned, 3 incident reports in 14 months. I want to see the other 2. He can get those to you tonight. Tell him I'll be in the lobby at 9. She ended the call and went to the locker room, changed back into her scrubs because the lobby was still technically a hospital space, and she was still technically a hospital employee until someone told her otherwise, and went downstairs. Duval was already in the lobby. He had a folder. He handed it to her without preamble and sat down on one of the waiting area chairs, and she sat across from him and opened it. The first case was a veteran nurse named Petra Hollins, who had completed 2 tours as a Navy corpsman and entered the transition program 18 months ago. She had been at Harlow General for 4 months before an incident report for unauthorized patient contact. She had responded to a code blue in a hallway and begun CPR before the official team arrived, led to a program review that resulted in her voluntary withdrawal. The file contained her withdrawal statement, which was 3 lines long and read like a document written by someone who had been convinced by a series of conversations that she had no viable alternative. The second case was a man named Dwight Caruso, Army medic, 11 months in the program. Incident report for performing a wound assessment outside his assigned patient load. Same pattern, same outcome. This time not a withdrawal but a reassignment to a different city, a different hospital, effectively ending his Harlow placement. Both reports had been filed by Deborah Sachs. Both had cited Program Regulation 4.7, the supervision requirement. Both had been processed through the coordinator's office, Helen Pfeiffer's office, without substantive review. Marsh's name wasn't on either one. He didn't need to be. The machinery didn't require him to be visible. Mara read through both files twice. She looked up at Duval. Hollins withdrew voluntarily, she said. After 3 meetings with Pfeiffer and Sachs in the same week, the documentation of those meetings is, he paused, sparse. Caruso was reassigned. Pfeiffer filed it as an accommodation. Different facility, fresh start. He folded his hands. He left the program 6 weeks after the transfer. She looked at the files. Who filed the original oversight complaint? Duval looked at her for a long moment. I'm going to tell you something that I need you to receive without reacting immediately. She waited. The complaint was filed through an anonymous channel. The oversight office has protocols for that. We protect those submissions. He paused. But based on what I've been able to establish in 3 days in this building, the person who filed it has been in this hospital for a long time. Long enough to watch all 3 of your cases. Long enough to understand the pattern from the inside. Staff. Yes. Someone with access to the program records. Or someone who worked closely enough with the affected trainees to see what happened to them. He looked at her steadily. I don't know who it is yet. And I'm not going to speculate out loud because in my experience, speculation in situations like this does more damage than silence. He paused. But someone in this building has been watching out for people like you for a while. And they did it at personal risk because if it came back to them, Sachs would file an incident report. At minimum. Mara sat with that. She thought about the 14 years Deborah Sachs had been at Harlow General. She thought about Priya Anand, who navigated the floor with the specific, careful energy of someone who had learned exactly how much space she could occupy without cost. She thought about Sandra in the ER, who had followed her lead without hesitation, and who had been the one to call her when Okafor coded. She thought about Okafor, asking for her by name. She closed the folder. 8 o'clock, she said. 8 o'clock, Duval confirmed. She handed the folder back and went home. She lived 12 minutes from the hospital in a 1-bedroom apartment that was clean in the functional rather than decorative sense. Nothing on the walls except a corkboard with a shift schedule pinned to it, furniture that had been selected for durability rather than aesthetics, a kitchen that was stocked with the specific efficiency of someone who ate to function rather than for pleasure. She had been here 5 weeks. Before this, a short-term rental on the other side of Calverton. Before that, a series of transitions she didn't think about in sequence because the sequence was demoralizing. She set an alarm for 6. She lay down without changing. She stared at the ceiling. She thought about the look on Marsh's face when she'd walked into Bay 1. The specific quality of his silence after Tavares's pressure stabilized. The way he had not said anything. Not thank you, not good work, not I was wrong. Just the silence of a man reorganizing around something he didn't have language for yet, because the language he'd built his career on didn't have a slot for it. She thought about what that silence was going to cost her in the morning. She slept for 5 hours, which was more than she'd expected. She was at the hospital at 6:50, in her scrubs, with her badge. She went to the ICU first. Okafor was sleeping. His rhythm on the monitor was still irregular, but the rate was better. The potassium was working. The overnight team had noted it in the chart. The morning troponin wasn't back yet. She read through the overnight notes, satisfied herself that his care was what it needed to be, and left without disturbing him. She went toward C. She did her morning checks. She took the mop when Deborah Sachs, without looking at her, set it at the end of the corridor. Because the act of refusing it this morning would be visible and interpreted, and she had not yet decided what she wanted to be visible. She mopped the hallway outside room 114, which was empty now that Okafor had been transferred, and she thought clearly and methodically about the meeting in 2 hours. At 7:20, Priya Anand found her in the supply room. Priya came in and closed the door behind her. That alone communicated the register of what was coming. I need to tell you something, Priya said. Mara set down the supply clipboard. Okay. The incident report Marsh filed yesterday. Priya's voice was even, but her hands weren't. She had them folded in front of her in the specific posture of someone containing agitation through deliberate physical control. I was in that bay. I watched what you did. And She stopped. I've been at this hospital for 3 years. I've watched 2 other trainees get pushed out. I watched Petra Hollins withdraw, and I knew what had happened to her. And I didn't do anything because I didn't think anything I said would matter. Mara watched her. I filed the complaint, Priya said, with the oversight office 8 months ago. I used the anonymous channel because I was scared, and I'm sorry it took me that long, and I'm telling you now because whatever happens in that meeting this morning, you should know that someone saw it before you got here. Her jaw was tight. Someone saw what this place does. Mara looked at her for a long moment. I know, she said. Priya blinked. I didn't know it was you specifically, but I had a sense. A pause. The way you navigate this floor, you know exactly where the edges are. That kind of map takes time to build. Priya's shoulders dropped slightly. The specific physical release of someone who has been braced for a reaction that hasn't arrived. I should have done more. You did something. That's more than most. If you get pushed out of this program, I won't. Mara said it simply, without performance. I didn't do anything wrong. The patient was dying, and I was the most qualified person who could help him. That's the argument, and it's a good one, and Duval is going to be in that room. She paused. You should be in that room too. Priya looked at her. As a witness? As someone who was present and documented nothing incorrectly. A pause. You have an obligation to provide accurate account. That's all it needs to be. Priya thought about it. She nodded. Once, the same compressed affirmative Mara had seen on people making decisions in much higher stakes environments than a supply room. Okay, she said. Okay. The meeting was in conference room B on the administrative floor, a room that Mara had never been in, and that looked like every other mid-level conference room in every institution in the country. A table that was slightly too large for the room, chairs with armrests that caught on the edge of the table, a projector nobody was using, a whiteboard with a dry erase marker resting in the tray that had probably been there since the previous administration. Helen Pfeiffer was already seated. She was a woman in her early 60s with the specific administrative competence of someone who had been doing exactly this job for a long time and had developed a refined ability to sit at a table and be simultaneously authoritative and uncommitted. Deborah Sachs was beside her, and at the far end of the table, having apparently arrived before anyone else, was Dr. Elliot Marsh. He looked up when Mara entered. He looked at her in the way he usually looked at her. The assessment of someone who has already categorized you and is simply confirming the category. And then Duval came through the door behind her, and Priya behind Duval, and something in Marsh's expression shifted in a way that was almost imperceptible and entirely legible. He hadn't expected Duval. Pfeiffer stood. Mr. Duval, I wasn't informed that oversight would be present. The notification was sent to the program administrative email at 6:45 this morning, Duval said, with the specific pleasantness of someone who anticipated this and prepared for it. I understand if you haven't had a chance to review it. The oversight of the transition program agreement, which was signed by Harlow General's administration when this site was approved. He sat down. He set his folder on the table. Please, don't let me interrupt the process. Pfeiffer sat back down. She was recalibrating in real time, which was visible in the way her prepared expression was taking slightly longer than usual to reconstitute. She glanced at Sachs. Sachs looked at the table. Marsh, Mara noticed, had not looked at Duval again since the first moment. He was looking at his own hands, which were flat on the table in front of him, and his expression had settled into the controlled blankness of someone who has decided not to show what they're thinking until they know what they're thinking. Ms. Solis, Pfeiffer began, you've received the incident report filed by Dr. Marsh, and I want to— The door opened. Mara turned. Commander Nathaniel Graves stood in the doorway. He was in uniform. She had not seen him in uniform since she left. 4 years. And the uniform itself was a thing that operated on her differently than she would have preferred, a Pavlovian response to a particular configuration of information that her nervous system had spent a decade treating as foundational. He had apparently made a decision about his level of involvement that overrode what she'd asked him, and she would deal with that later. But right now, his presence in the doorway, in uniform, with the rank visible, in this specific room at this specific moment, was doing something to the atmosphere that she could feel even before he spoke. Commander Graves, she said, and her voice was even. I told you I didn't need— You told me not to make a call, he said. He stepped into the room. I didn't make a call. I'm here because Sergeant First Class Dominic Tavares has requested a formal after-action review of the medical response to his injuries, which is his right as a service member, and that review requires my presence and testimony regarding the clinical intervention that kept him alive. He looked at Pfeiffer. That testimony is going to be provided to this body or to whatever body convenes to hear it. Ms. Solis doesn't control that process. Sergeant Tavares initiated it this morning at 0600. Pfeiffer looked at Marsh. Marsh looked at Graves, and then, slowly, he looked at Mara. And in that look was the specific quality of a man who is beginning to understand that the ground under a position he's occupied for years is not as solid as he believed, and who doesn't yet know what to do with that information, but whose face is already doing the work of processing it before his mind has caught up. Mara did not look away. She held his gaze across the table, and she thought about Terence Okafor in the ICU 2 floors below, with his irregular rhythm and his potassium drip, and the photograph of his wife she'd noticed on the small table beside his bed when she'd gone in this morning. A woman with a too loud laugh and a 41-year-old love story and a biology classroom somewhere in this city where the students probably still remembered her. She thought about Petra Hollins, who had written 3 lines and walked away. She thought about Dwight Caruso, who had left 6 weeks after the transfer. She did not move. She did not look away. She waited for the room to catch up to what she had already decided. And then Pfeiffer opened her mouth to begin the formal proceeding, and Duval opened his folder, and Priya straightened in her chair beside Mara. And from the hallway outside came the sound of footsteps, 2 sets, moving with the compressed urgency that Mara's nervous system had been calibrated to recognize across 9 years and several continents. Rogelio Fanta appeared in the open doorway, slightly out of breath. He looked at Mara, only at Mara. "ICU," he said. "Okafor." His troponin came back. "It's elevated, and his rhythm is deteriorating again. Dr. Ewan is asking for you specifically." Every person in the room looked at her. Marcia's face was doing something she didn't have time to interpret. Mara was already standing. "We'll need to reschedule," Duval said to Pfeiffer, with the particular quiet authority of someone who has just watched an administrative proceeding become irrelevant to a human being's survival. Mara was through the door before he finished the sentence, and Graves was a half-step behind her, and the conference room, with its 2 large table and its dry erase marker, and the 2 people at the head of it who had expected this morning to go very differently, was already 30 feet behind her and getting smaller. She hit the stairwell at a run. Not the compressed fast walk. A run. Because Rogelio said deteriorating, and Rogelio was not a person who used that word unless he meant it. And somewhere above her an old man with an irregular heart was lying in a bay, asking for someone who saw things the way they were, and she was the person he'd asked for. And the troponin elevation meant this wasn't just an arrhythmia anymore. She burst through the ICU door at a dead run, and Rogelio was right behind her, and through the glass of Bay 6 she could see the monitor. The rhythm fragmented, the rate climbing, the waveform doing the specific ugly thing that a cardiac monitor does when the situation is changing fast. And she could see Dr. Yuen at the bedside already, and she could see Okafor's eyes open, tracking the door, finding her through the glass. She pushed through the bay door. "Solis?" Yuen's voice was controlled and fast. "Troponin is 4.2. He's trending toward flutter with 2-to-1 block. I need a second set of hands, and I need them to know what they're doing." "I'm here," Mara said, already gloved. Okafor's eyes found her through the oxygen mask and stayed there. "Mara," he said, and his voice was wrong, thinner, pulled at the edges by effort. "It's getting loud in here." "I know." She moved to his side. She took his wrist, not for a pulse, she had the monitor for that, but because it was the right thing to do for a man who was scared and who had asked for her by name. "I've got you." "Don't let them send me somewhere quiet," he said. "You're not going anywhere." "I mean the room. They keep threatening the quiet room." She almost laughed. She squeezed his wrist instead. "You're staying right here," Ewan was calling orders. Mara moved between his bedside and the equipment with the fluid efficiency of someone who has done this in conditions where the equipment was less and the light was worse, responding to Ewan's directions not as instructions she needed to process, but as a language she was already fluent in. And the 2 of them worked together with the specific synchrony that develops between people who are competent at the same thing and have enough situational intelligence to communicate in shorthand. Outside the bay glass, in the ICU corridor, she was dimly aware of people gathering. Rogelio, two other nurses. Graves, who had apparently followed her up the stairs and was standing at the periphery with the contained stillness of a man who knows that the best thing he can do right now is be invisible. And behind him, having apparently followed from the conference room in a way that suggested the meeting had not simply adjourned but had simply stopped, Marsh, standing at the glass, watching. Mara did not look at him. She was managing Okafor's arterial line, adjusting the fluid rate, reading the monitor in real time, and feeding the information to Ewan in the compressed professional shorthand that she'd spent a decade building, and that here, in this bay, was exactly as useful as it had ever been in any forward operating base in any country she'd worked in. Okafor's rhythm climbed, peaked, and then, with the potassium adjusted, with the rate control medication that Ewan had ordered now in the line, began, incrementally, to come down. Not fast, not clean, but down. The monitor's alarm stopped. Mara looked at the waveform. She looked at Okafor, whose eyes had closed, whose breathing had eased slightly beneath the mask. She checked his radial pulse manually because she wanted the tactile confirmation, not just the electronic one. 68 beats per minute, irregular but manageable. She straightened. Ewan was looking at the monitor, then at Mara. Good, she said, which in the economy of this woman's vocabulary was the equivalent of a standing ovation. Mara looked at her hands. She looked at Okafor, asleep now, the lines in his face somewhat less deep than they'd been when she came through the door. She became aware, in the specific order that you become aware of things when the immediate crisis has released, of several facts simultaneously. That Graves was still outside the glass. That Marsh was also still outside the glass. That Duval had appeared at some point and was standing behind both of them, his folder under his arm, watching through the glass with the particular expression of someone who has just witnessed an exhibit. And that behind Duval, partially visible around the ICU corridor corner, was Helen Pfeiffer, who had, it appeared, followed them all, who was looking at Mara through the glass with an expression that Mara couldn't fully read from this distance, but that had in it, unmistakably, something that had not been in her face during the meeting downstairs. Mara looked away. She checked Okafor's line. She updated his vitals in the chart. She did the next thing, and then the next thing after that, because that was how you did this job. Not as a sequence of dramatic moments, but as a continuous accumulation of small, careful actions that together constituted care. Then Rogelio appeared in the bay door and said, quietly, "Dr. Marsh wants to speak with you." Mara finished the chart entry. She capped the tablet. She peeled off her gloves. "Tell him I'll be out in a minute," she said. She took the minute. She needed it. Not for composure, she had that, but for the specific kind of stillness that let her walk into a difficult conversation without bringing the last hour into it. She stood at Okafor's bedside and listened to the sound of his breathing and the blip of the monitor and the ambient sounds of an ICU doing its job. Then she walked out. Marsh was in the corridor. He was alone. Graves had moved down the hall. Duval was speaking quietly with Pfeiffer near the exit. Rogelio had returned to his desk. Marsh was standing with his hands at his sides, which was not his usual posture, and something had shifted in his bearing in a way that was small and significant. He looked at her. "I didn't know about the other two trainees," he said. She looked at him. She said nothing. "Hollins and Caruso." His jaw moved. "I didn't know their names until Duval said them in the meeting. I didn't—" He stopped. I'm not saying that makes anything acceptable. I'm saying I didn't know." "What did you think happened to them?" He didn't answer that. "You knew they were gone," she said, without heat, just evenly. "You knew trainees came through and left early, and you didn't ask why." His face did something she couldn't categorize and didn't try to. "The incident report," he said. She waited. I need to review it." He said it like the words had a different weight than he'd anticipated they would. "Before the rescheduled meeting." "Okay," she said. He looked at her. He opened his mouth and then closed it and then said, "You saved Tavares?" "Yes." "And the patient upstairs?" Dr. Ewan made the clinical decisions. "You know that's not—" He stopped. He looked away. He looked back. "I've been in this department for 9 years," he said. "I know what I saw in Bay 1. Mara held his gaze. "Yes," she said. "You did." He nodded. It was a small motion, and it cost him something she wasn't going to measure, because measuring it was not her job and the accounting of it was not her concern. He turned and walked toward the elevator. She watched him go. Down the corridor, Duval and Pfeiffer had stopped talking. Pfeiffer was looking at the folder Duval was holding. Duval was speaking, and whatever he was saying, Pfeiffer was listening with the expression of someone whose mourning has substantially altered the way they understand the past 14 months. Graves appeared beside Mara. He said nothing. "I told you not to come," she said. "Tavares has a right to request an after-action review. I testified truthfully." A pause. "I didn't make a call." She almost said something. She didn't. "How is he?" Graves asked. Okafor, he meant. "Stable. He needs time." "So do you." She looked at the ICU door, at the glass of Bay 6 and the monitor beyond it, and the sleeping form of an old man who had, in the space of one day, told her to stay, and then nearly left. "I'm fine," she said. That pause again. "Graves." "I know." He was quiet. "I know." Then, the after-action documentation. Tavares's formal request generates a record. That record becomes part of your file, the civilian program file. It documents the intervention, your qualifications, the outcome. He paused. That documentation doesn't go away. Whatever happens with the incident report, the record of what you did in Bay 1 is now permanent. She absorbed that. "You didn't tell me that this morning," she said. "You didn't ask." She looked at him. He was looking at the ICU door. "Why did you really come?" she said. He was quiet for a moment. A long one, the kind he used when the answer wasn't something he was going to organize before he gave it. "Because 9 years ago," he said, "I made a call that you told me was wrong. And I made it anyway. And 3 people died who—" He stopped. "And you left. And I have spent a lot of time since then thinking about what I owe that." The ICU was quiet around them. The monitors beeped their steady, irregular rhythms. "You don't owe me anything," she said. "I know that." He turned and looked at her directly. "That's not why I'm here." She held his gaze, and in his face was something she hadn't seen in it before, or had seen and not registered, because the context hadn't been right, because she hadn't been looking at him the same way then. Not obligation, not guilt repackaged as loyalty. Something older than that, and less comfortable, and more honest. Before she could respond, Rogelio's voice cut across the corridor from the nurse's desk, sharp and direct. "Solis, Bay 6. He's awake and asking for water, and he says, and I quote, he won't accept it from anyone except the nurse who repositioned him this morning." Mara looked at Graves. "Go," he said. She went. She was halfway to the bay when her pager, the hospital pager, the one linked to her general employee profile, went off with a code she hadn't seen before. She looked at it. The code was a security designation. It meant law enforcement in the building, not police. The other kind. She stopped walking. Rogelio, who had seen the same notification light up the desk system, looked at her with an expression she couldn't quite read. "Administration just called," he said, his voice careful. "There are federal investigators in the building. They arrived 20 minutes ago." He paused. "They asked for the personnel files of the emergency department chief and the Ward C charge nurse." The corridor was quiet. Mara looked at the pager in her hand. She looked at the ICU door. She looked at the place in the corridor where Duval had been standing, which was now empty. Duval, who had been here for 3 days before any of this, who had said, "I'm here because someone put in a complaint," who had a folder and a quiet voice, and the specific unhurried quality of someone who has been building something for a while and is now simply watching it stand. From inside Bay 6, she could hear Okafor's voice, rough and dry and present. "Mara," he said. "Water, please, while I'm still young." She put the pager in her pocket. She pushed through the bay door. She filled the cup from the pitcher on his tray, held the straw steady while he drank, and watched his color as he did it. The specific assessment that never fully turns off. The clinical overlay that runs underneath every ordinary interaction, whether she wants it to or not. He drank half, then pulled back from the straw and exhaled slowly. "Better," he said. "Good." He looked at her with the eyes of a man who is tired but present, who has been through something and is on the other side of it and knows the difference.
You were running when you came through that door. You were deteriorating. I know, I could tell. He paused. Felt like something pulling on me. From the inside. He looked at the ceiling. Not how I expected it to feel. How did you expect it to feel? He thought about it. Quieter, he said. She checked his line, checked the monitor.
The rhythm was holding, still irregular, still the imperfect patchwork of a heart that had been stressed beyond its comfortable range, but stable in a way that was real rather than precarious. The troponin elevation was a problem for the next 12 hours of monitoring, not for this exact moment. Your son, she said. Dr. Ewan's going to want him contacted. I know. He closed his eyes briefly. He's going to panic. Probably. He's going to book the first flight he can find and arrive here looking like he hasn't slept. Also probably. He's a good kid. A pause. Man, he's 43. I keep calling him a kid. He opened his eyes. You have family, Mara? A sister, in Portland. You close? She adjusted his blanket, which had shifted. Closer than we used to be. He nodded like he understood the particular arithmetic of that. The way some relationships improve by surviving the years rather than despite them. He was quiet for a moment, and she let the quiet sit because it was a comfortable one, the kind that didn't require filling. Then he said, Something happened out there while you were in here. She looked at him. I could tell by the sound. The corridor sounds changed. He paused. More people, different voices. His eyes were steady on her. Are you in trouble? She considered lying and then didn't because he'd called her by her given name in a moment of cardiac crisis, and that purchased a certain level of honesty. There are federal investigators in the building, she said. They arrived about 20 minutes ago. He absorbed that without apparent surprise, which was interesting. For who? Marsh. And Sachs, I think. A silence. Not for you. No. He was quiet for a moment. Good, he said, with a finality that closed the subject and didn't require elaboration. He settled back against the pillow. Then go do what you need to do. I'm not going anywhere. Someone will be at the desk. I know how a hospital works, Mara. I was in one for 18 months after Kandahar. He gave her a look. Go. She went. In the corridor outside the ICU, the atmosphere had shifted in the specific way it shifts when something institutional is happening. People moving with more purpose than their tasks require. Conversations that stop when someone comes around a corner. The low electrical charge of an organization that senses something changing at its center. She had felt this before in other institutions, in other contexts, and the sensation was the same regardless of the setting. The feeling of a structure under pressure at a point that isn't visible from the outside. Duval was at the end of the ICU corridor, speaking with a woman in a dark blazer who was holding a leather portfolio and had the bearing of someone who makes her living in rooms where no one wants her there. Mara didn't approach them. She observed from 30 feet away, enough to read the body language, which told her the conversation was controlled and proceeding in a direction Duval had already mapped. Graves appeared from the stairwell. He had been somewhere. She could tell because his expression had organized itself around information. He hadn't had 20 minutes ago, the kind that requires a moment to settle before you can present it in a form that's useful. He came to her and said low, Marsh pulled the incident report. She looked at him. When? 40 minutes ago, before the federal investigators arrived. A pause, which means he either knew they were coming or he saw Duval's folder and made a calculation. It doesn't matter which. No, he said. But it tells you something about what he understands the exposure to be. She thought about what Marsh had said in the corridor. I need to review it. The careful, diplomatic phrasing of a man beginning to understand that the document he filed had a longer reach than he'd intended. Pulling it was the correct tactical move. It was also the move of someone who is trying to limit damage rather than someone who believes he acted rightly. There was a difference. She was aware of it, and she suspected Duval was aware of it, and she suspected Marsh was now, belatedly, aware of it too. The other two, she said, Hollins and Caruso. Are they in Duval's scope? They're in the federal scope, which is bigger. Graves looked at the woman in the blazer at the end of the corridor. That's an investigator from the Department of Defense Inspector General's office. She wasn't here yesterday. Mara looked at him. She came because of Tavares's after-action request.
She came because of the after-action request combined with the existing oversight complaint, combined with Duval's 3 days of preliminary findings. He paused. One of these things can be managed. 3 of them together is a different calculation. She looked down the corridor. Duval had finished his conversation, and the woman in the blazer was moving toward the elevator. Not up, which meant she was going down, which meant the administrative floor, which meant Pfeiffer's office, or Marcia's office, or both. What does this mean for the program review meeting? She asked. Pfeiffer rescheduled it. Friday, if the situation allows. Graves watched the elevator doors close.
In the meantime, your program placement is on administrative hold, not suspended hold. There's a difference. You're still badged, still credentialed for the ward, still active. It just means nothing formal happens until the review proceeds. That could be weeks. Yes. She absorbed that. It was not the outcome she would have chosen, but it was substantially better than the outcome that had been available to her 8 hours ago, and she had enough tactical sense to recognize the difference between a delay and a defeat. Okafor still needs his ward care managed, she said, regardless of the hold. Yes. Then I go back to work. Graves looked at her. That's it? What do you want me to say? I don't know. Something. Mara, what happened in the last 18 hours is significant. I know it's significant. She looked at the ICU door. But the significance doesn't change what needs doing in the next 4 hours. Okafor needs his potassium rechecked and his wound care documented for continuity and his son contacted through the right channels. She paused. And Priya needs to know that whatever she put at risk by filing that complaint has not been wasted.
He was quiet for a moment. Then, you are the most pragmatic person I have ever met. I've been called worse. He didn't quite smile, but something shifted in his face. I'm going to be at the hospital through tomorrow. After that, we move Tavares to a higher-level facility for follow-up. Good. He should have the specialized care. He asked about you this morning, before the after-action request. He asked who you were. What did you tell him? I told him you were the most
Qualified combat medic I ever worked with who happened to be in the right place at the right time. She looked at him. That's a generous interpretation of what I'm doing here. Is it wrong? She didn't answer that. She went back into the ICU. The rest of the morning was the ordinary work of an extraordinary day settling back into its proper scale. She confirmed with Rogelio that the potassium check would run at noon. She contacted the nursing coordinator about Okafor's son. An Air Force Family Readiness officer could facilitate the overseas notification through proper channels, which was cleaner than a direct call, and would give the son information from an official source rather than arriving as a surprise. She documented the morning's events in Okafor's chart with the precise, unembellished language of clinical notation: what happened, in what order, what interventions were made and by whom, what the results were. She made it clean, and she made it thorough, and she made it the kind of record that would survive review by anybody that looked at it. She found Priya in the break room at 11:15, eating a sandwich she was clearly not tasting, looking at her phone without seeing it. Mara sat across from her. They pulled the incident report, she said. Priya looked up. Something moved through her expression. Relief, but the kind that's been waiting so long it doesn't know how to arrive cleanly. Marsh pulled it? Yes. Before or after the investigators? Before. 40 minutes before. Priya put her phone down. She looked at the table. Does that mean? It means the formal complaint against me has been withdrawn. The oversight review of the program is still proceeding. The IG investigation is separate and I don't know the full scope of it. Mara paused. What it means for you is that the complaint you filed generated a federal investigation, which means it will be reviewed and protected as part of that process. Your name is protected under the anonymous channel. But if they look carefully, they will look carefully, Mara said. That's what investigators do. But the law protects the source of a whistleblower complaint. If anyone in this hospital takes action against you for filing it, that becomes its own violation. She held Priya's gaze. You did the right thing, at personal cost. That matters. Priya was quiet for a moment. It took me 8 months. You did it, that's the relevant part. Hollins, Priya said, and Caruso. If the investigation, it's in the scope. Duval confirmed that. Another silence. Priya picked up her sandwich, looked at it, put it back down.
How do you do that? She said. Just go from crisis to crisis and stay level.
Mara considered the question. You stop expecting the ground to be solid, she said. Once you stop expecting it, you stop being surprised when it isn't. Priya absorbed that. That doesn't sound like a good way to live. It's a workable one. At 12:30, Mara's badge access chimed her into Ward C with the standard daily confirmation. No flags, no restrictions. The Holdgraves had mentioned generating nothing visible in the access system. She took a full patient load for the afternoon. Not because anyone assigned her one, but because she looked at the board and identified the gaps and filled them, which was the thing she had been doing for 6 weeks with or without formal recognition, and which she was going to continue doing because the patients didn't know about incident reports or federal investigators or program holds, and their need for care did not wait for institutional processes to resolve. She repositioned an 80-year-old woman with hip fracture in Bay 3 who had been lying at the wrong angle for 2 hours. She adjusted the medication timing for a diabetic patient in Bay 7 whose glucose management had been drifting in a direction nobody had caught because the shift change notes were incomplete. She assisted a junior resident named Theo Park on a dressing change that was more complicated than he'd anticipated, talking him through it without making him feel managed, which was a skill she'd developed specifically for residents who were good enough to know they were in over their heads, but proud enough to resist asking for help. At 2:40, Sachs did not appear on the floor. At 3, Mara learned through the ambient information system of a functioning hospital ward, the transfer of knowledge through proximity, through overheard half-sentences, through the expressions on faces she'd learned to read, that Deborah Sachs had been called to a meeting with hospital administration and the IG investigator and had not returned. At 3:20, Gerald Purvis came out of the coordinator's alcove looking like a man who has just learned that a structure he lived inside was not as stable as he'd been assured, and went to find the interim charge nurse. Mara watched him go and went back to Bay 7. At 4:15, she went up to check on Okafor. He was awake and more alert than he'd been that morning, which was a good sign, the kind of incremental improvement that doesn't announce itself but accumulates into a patient who looks substantially better by end of day than they looked at start. His rhythm on the monitor had organized itself into something the cardiologist would describe as controlled atrial fibrillation, which was not ideal, but was manageable long-term with the right medication regimen. The troponin trending would tell the fuller story, but the trajectory was encouraging. He had a photograph on his bedside table that hadn't been there this morning. A woman. The too loud laugh was visible even in a still photograph, something in the set of her mouth, the angle of her eyes. Margaret Okafor. Someone had brought it from his room downstairs, or he'd asked for it, or it had been in his things when he was transferred. She didn't ask. "My son called," he said when she came in. "How did he take it?" "About how I expected." A pause. "He's flying in Friday." He looked at the photograph. "I told him not to, but he doesn't listen. Never did." "Good," she said. He looked at her. "Good? He should be here. You'd feel better with him here, even if you won't say so." Okafor made a sound that was not quite disagreement. "He worries too much." "He loves you. That's different from worrying too much." She checked his wound, which Rogelio had dressed that morning and which looked better. The stage 2 was responsive to proper treatment, as stage 2s are when they're caught before they progress. "This is healing well." "Because you caught it." "Because it was caught and treated. The sequence matters." He was quiet while she finished the assessment. Then, "What happened downstairs today? I heard voices in the hall that sounded like official voices." She sat in the chair beside him. "The hospital is being investigated for how it's treated veteran nurses in the transition program." He was still. "Because of what happened to you." "Because of a pattern that predated me by over a year. I'm the third case. The investigation was already in motion when I got here." She paused. "I just gave it something concrete to look at." Okafor looked at the ceiling. His expression was doing something complex and slow, the expression of a man sorting through several things at once. "The doctor," he said. "Marsh. He withdrew the report he filed against me. And the woman, Sachs. I don't know the full scope of what's happening with her. The investigation is separate from what I'm directly involved in." He looked at her. "Does it feel like justice?" She thought about that. "It feels like process," she said, which is the best version of justice most situations get. He considered that for a long time. Margaret would have said the same thing, he finally said. She was a pragmatist, used to drive me crazy. He looked at the photograph. I miss it now, the drive me crazy part. She stayed with him until 5. When she left, he was looking at the photograph and not at the ceiling, which felt like a good direction. In the stairwell between the second and first floors, she sat on a step for 4 minutes. Not doing anything, just sitting. Her back against the cinder block wall, the fluorescent light above her buzzing very faintly at a frequency that would drive most people to distraction and that she'd long since learned to tune out. She breathed. She let the day exist for a moment without moving through it. Then she got up and went downstairs. The administrative wing at Harlow General was on the ground floor, east of the main lobby, behind a set of glass doors with the hospital logo etched into them. She had been in the administrative wing twice in 6 weeks, once for her orientation paperwork and once to submit a scheduling form. She had no scheduled reason to be there now. She went anyway. The woman in the dark blazer, the IG investigator, was in the corridor outside Pfeiffer's office, speaking with a man Mara didn't recognize who was taking notes on a tablet. She passed them on her way to the interview room at the end of the hall, which was the room Duval had indicated via a text she'd received at 4:57 that he'd be available in until 6. She knocked. He said, "Come in." He was alone. He had the folder on the table and a second folder beside it that she hadn't seen before. He looked up when she came in. "Sit," he said. She sat. "How's Okafor?" "Improving. His son is coming Friday." "Good." He folded his hands. "The incident report has been officially withdrawn from your program file. I've confirmed that with Pfeiffer's office, and it will be reflected in the formal record by tomorrow morning." He paused. "The program hold will be lifted contingent on the completion of a review meeting, which will proceed Friday at the same time as the originally scheduled meeting, reconvened." "Marsh will be there?" "Marsh will be represented. He won't be in the room." She looked at him. "Why not?" Duval opened the second folder. He turned it so she could see the top sheet without reading the full content. Enough for her to register the letterhead, the heading, the nature of the document. It was a notice of administrative suspension pending investigation, signed by the hospital's chief medical officer. Marsh's name was at the top. "That was issued at 3:15 today," Duval said, "at the request of the IG investigator and confirmed by the CMO after a 2-hour review." He closed the folder. "He is not legally barred from the premises yet. The suspension is administrative, not criminal at this stage. But he has been removed from his department chief role and his clinical privileges are under review." She sat with that for a moment. "Because of the pattern with the trainees. Because of that, and because of what the IG found when they looked at his department's documentation practices over the past 3 years. The trainee situation is one thread." He paused. "It's not the only one." She looked at the closed folder. She thought about Marsh's face in the corridor, the specific quality of a man who is beginning to understand the actual size of the thing that's under him. "He didn't know about Hollins and Caruso," she said. "He told me that. He may have been telling the truth. Does that matter to the investigation?" For the specific question of whether he directed their removal, probably yes. For the question of whether he created and maintained a culture that made that removal possible without his knowledge or objection, no. Duval held her gaze. "The investigation will determine what he knew. What I can tell you is that the IG does not issue administrative suspension notices as a precaution. They have something." She absorbed that. "Sacks. Different process, same origin. The interviews are ongoing." He paused. "I'm telling you this because you're directly affected, not because you're entitled to the details of an active investigation. The details are not mine to share." "I understand." "What I can tell you," he said, "is that you will walk into that meeting on Friday with a clean file, a withdrawn complaint, and the documented record of a military service member's formal after-action request that credits your intervention with his survival." He paused. "The meeting on Friday is going to be substantially different from the meeting this morning." She looked at the table. She thought about the conference room, the too large table, the dry erase marker, the careful neutral expression on Pfeiffer's face. The way it had felt to sit there with the weight of 6 weeks of invisible work and 2 prior cases and a morning that had started with a mop. "What happens to the program?" she asked. "At this site." Long term. Duval was quiet for a moment. That's a question for the Oversight Office's formal review, which will happen after the investigation concludes. He paused. But I can tell you that the site's program agreement includes a compliance provision. If the site is found to have systematically violated that agreement, the program placement at Harlow General can be suspended or revoked. He looked at her. Which would mean that no veteran transitioning to civilian nursing could be placed here until the compliance issues are resolved. Would that help anyone? It would send a message to the other 42 sites in the program. She thought about that. And the trainees already placed at those other sites. Yes. She looked at the window. The late afternoon light was doing the thing it did at this hour, in late fall, coming in low and slightly orange, and making everything look more consequential than it probably was. Petra Hollins, she said, is there a way to... The Oversight Office can recommend reinstatement for any trainee who withdrew under circumstances that are found to have been procedurally improper. He held her gaze. That recommendation is not binding on the program director, but it carries weight. And Caruso? Same process. She nodded. She sat with the knowledge that can recommend and carries weight were the realistic vocabulary of institutional justice, rather than the clean vocabulary of the kind that happened in stories, and that this was, despite everything, more than she had thought this morning was possible. Thank you, she said. She didn't say it often, and she meant it in full when she did. Duval looked at her with an expression that was professional and warm in equal measure. The face of someone who has done this work long enough to understand that the outcomes are rarely clean and the process is rarely fast, and the people who get through it intact are the ones who are going to get through it regardless. Don't thank me, he said. Someone in this building watched 2 people get pushed out and documented it at personal risk and filed it through the proper channels and waited 8 months for anyone to listen. He paused. Thank whoever that was. She left the administrative wing at 5:40. In the main lobby, she stopped. Voss was there. The younger man, Tavares' teammate, who had been in the parking lot and the hospital corridor and the bay and the waiting area at various points during this long, impossible day. I was sitting in one of the lobby chairs with a paper coffee cup that was probably cold, elbows on his knees, looking at the floor. He looked like a man who has been running on adrenaline for 24 hours and has just run out. She sat in the chair across from him. He looked up. Some of the tension in his face reorganized around something that was not quite relief and not quite gratitude, but lived in the neighborhood of both. Hey, he said. Hey, I heard about the meeting this morning, the investigation. Word travels. Hospitals, he said, with the specific economy of someone who grew up around institutions and understands their information velocity. He looked at his coffee. Tavares is asking about you. He's asking about everyone. That's how you know he's fine. Voss almost smiled. He wants to know what you were doing in a civilian hospital in Calverton, wearing scrubs and mopping floors. It's a transition program. He knows that. He wants to know why. He looked at her directly. I don't know why either, actually. The commander explained the program, but not... He stopped. Not why someone with your record would be starting over. She looked at the lobby, the front desk, the sliding glass doors, the parking lot beyond where the Navy vehicles had been, and where now there was just an ordinary afternoon. Because I wanted to be a nurse, she said. Just a nurse, without the other parts. He thought about that. Did it work? She looked at him. The other parts showed up, she said. Apparently they don't detach. He did smile this time briefly. Tavares says the same thing. Tried to retire twice, keeps getting called back. He paused. He says some people are just built for it. He's a man who was in critical condition 14 hours ago. He's allowed to be philosophical. Voss looked at his coffee. Thank you, he said, for what you did in the bay. You're welcome. And for... He stopped. He's got a daughter. Did the commander tell you? He mentioned it. 7 years old, she makes him videos on his phone. Every week, a new video. He watches them when things are bad. He looked at the doors. He watched 3 of them in the vehicle before we got here. Before he went under. Mara sat with that for a moment. The weight of it, which was real, and the weight of the fact that she did not need to carry it with her going forward, which was also real. She had done the things she could do. The rest was Tavares' life to live. Take care of him, she said. Always, Voss said, and meant it in a way that was both professional and not. She stood. She was almost to the elevator when the lobby doors opened and Graves came through them from the outside, in civilian clothes now, the uniform gone. He stopped when he saw her. She stopped. Across 20 feet of lobby tile, in the ordinary light of a late afternoon, they looked at each other. He came toward her, stopped 3 feet away. "I was going to find you." "You found me." He looked tired. She hadn't seen him look tired until now. He had been controlled and deliberate all day, the way he'd been trained to be, but the training had limits, and apparently this was where they were. "I have to tell you something," he said. "Okay." "When I came in this morning, when I saw you in the corridor and I knew it was you, the first thing I felt was relief." He said it like a man who has decided to stop managing what he says and simply say it. "Not because of Tavares. Before I even processed Tavares. The first thing was just, you're here." She looked at him. "Graves? I know." He shook his head slightly. "I know this isn't the conversation. I just needed to say it once, and then I'll stop because you've had the day you've had, and I'm not going to put something else on it." She looked at him for a long moment. The lobby moved around them. A family coming in through the doors, a nurse crossing to the elevator, an orderly with a cart going the other way. The ordinary machinery of a hospital. "Ask me again," she said. "In a month." He looked at her. "What?" "Whatever you're building up to, ask me in a month." She held his gaze. "When this is resolved and Okafor is home and the investigation has moved forward, and I'm not standing in a lobby at the end of the longest day I've had in 4 years." She paused. "Ask me then." He was quiet for a moment, then, "A month. Or thereabouts?" He nodded. It was a different nod from the ones he'd been giving all day, smaller, less controlled, the nod of a man who has just been given something he wasn't certain he was going to receive. "Okay," he said. She went to the elevator. She was almost there when her phone buzzed. Not a call. A text from a hospital number she recognized as the administrative wing. She read it. It was from Helen Pfeiffer. 2 sentences. The first, "Friday's meeting will include a formal review of program administration practices at this site, conducted jointly with the Oversight Office." The second, "You are requested to provide a written account of your experience in the program to date, to be submitted by Thursday morning." She put the phone in her pocket. She pressed the elevator button. The doors opened. Standing inside the elevator, looking at her with the expression of a man who had just come from a meeting that had clearly gone in a direction he hadn't intended and who had not yet decided what he was going to do about it, was Elliot Marsh. They stood in the particular stillness of 2 people who have not planned this encounter and are both deciding, in real time, what it will be. Marsh looked older than he had that morning, not dramatically, not the collapse of a man who has been destroyed because he hadn't been, not yet, and perhaps not entirely, but older in the specific way that a day of sustained institutional pressure ages a person. The careful authority that he wore like a second skin had loosened somewhere around the edges. His eyes were doing something they hadn't done in any of their previous interactions, something that she recognized as the preliminary work of a man preparing to say something he doesn't have a script for. The elevator doors began to close. He put his hand out and stopped them. "I was going to find you," he said. "People keep saying that to me today." He stepped out of the elevator. The doors closed behind him. They were in the lobby, and there were people around them, and neither of them moved toward a more private space, which meant this was going to happen here. "The investigation," he said. "Yes. I want you to know I didn't, the way the trainees before you were handled, I didn't direct it." "I know." He looked slightly thrown by that. The rapid agreement, the absence of the argument he'd prepared to counter. "You know. Duval told me. Not directing it and not asking questions about it are different failures, but yes. I believe you didn't send specific instructions to remove them." She held his gaze. "I think what you did was build a department where that could happen without you needing to know about it, where the culture handled it for you." His jaw tightened. Not in anger, in the specific tension of a man receiving an accurate diagnosis of something painful. "That's a distinction that may not matter to the investigation." "It might not," she agreed, "but it matters to whether I think you're the kind of person who can change, so I'm making it." He was quiet. He looked at the lobby doors, at the parking lot, at the ordinary Thursday evening outside. "The report," he said. "I pulled it. I know. It was the right thing to do. Yes. I should have—" He stopped, started again. "I should have gone into that bay and asked your name before I told you to step back. I should have done that 6 weeks ago." He said it with the specific difficulty of someone who has not practiced at this kind of honesty and who has decided to do it anyway, imperfectly, because the alternative is worse. "I don't have a good explanation for why I didn't." She looked at him. "You do have an explanation. You just don't like it." He met her eyes. "You looked at me and saw a trainee," she said. "Not because you didn't have the information to see more. Because seeing more would have required you to adjust how you operated, and you didn't want to adjust." She said it evenly, without cruelty. "That's the explanation. It's not a good one, but it's the true one." The lobby moved around them. A child crossed the floor pulling a stuffed animal. A man in a visitor badge asked the front desk for directions. The sliding doors opened and closed on the November air. Marsh looked at her for a long time. "Are you going to be at the Friday meeting?" he said. "Yes." "What will you say?" "The truth," she said. "What happened? In what order? The same thing I'd document in a chart." She paused. "I'm not interested in your destruction. I'm interested in this not happening to the next person." He was quiet for a moment. Something moved through his expression that she wasn't going to try to name, because naming it wasn't her job, and whatever it was his to carry. He nodded. Once, small, the nod of a man who doesn't have the language yet for what he's feeling, but is at least honest enough to acknowledge the weight of it. He walked toward the exit. She watched him go. Then she pressed the elevator button again and went upstairs and did not think about him for the rest of the evening, because the rest of the evening had enough in it already. She spent 2 hours writing the account Pfeiffer had requested. She wrote it at the nurses' station on Ward C during the quiet of the late shift when the floor had settled into its overnight rhythm and the paperwork was caught up and there was a coffee going cold at her elbow that she kept not drinking. She wrote it the way she wrote clinical notes, factual, sequenced, precise, without editorializing, because the facts were sufficient. They didn't need ornamentation. What had happened to her was unremarkable in the way that systemic injustice is usually unremarkable. A series of small decisions by people who were never required to examine them, accumulating into a pattern that cost real people real things. She wrote about Petra Hollins, who she had never met, and what her withdrawal statement communicated between its 3 careful lines. She wrote about Dwight Caruso, whom she also didn't know, and the reassignment that had functioned as a removal. She wrote about 6 weeks of mop handles and cleaned floors and clinical expertise treated as a liability. She wrote about Terence Okafor's wound that went undocumented and what that delay had cost him. She did not write it as a grievance. She wrote it as a record. She submitted it at 9:47 and went home. Thursday passed in the machinery of ordinary hospital work, the kind of day that doesn't make stories but makes patients better or worse, depending on how carefully it's done. Okafor's troponin had peaked and begun to trend down, which was what you wanted to see. His rhythm was holding. He was eating real food and complaining about the consistency of the oatmeal, which Mara took as a reliable indicator of recovery. She told him so, and he told her the oatmeal was genuinely terrible, and she told him she'd note his feedback in the chart, and he laughed, which made the monitor blip and made them both look at it, and then look at each other with the shared acknowledgement of people who understand what it means when a number on a screen tells you someone is alive. Priya worked the Thursday day shift on Ward C, and the dynamic was different. Not dramatically, but perceptibly. Deborah Sachs had not returned to the floor. The interim charge nurse was a woman named Arayez Nwoku, who had been at Harlow General for 6 years on the night shift, and who had the calm, undemonstrative competence of someone who has seen enough to stop being surprised by what gets uncovered when an institution is finally examined. She assigned Mara a full patient load at the start of the shift, without comment, and they worked together without friction. At 2 in the afternoon, Theo Park, the resident Mara had helped with the dressing change, appeared at the nurse's station and asked her with the specific careful casualness of a young physician who is trying not to look like he's asking for help, whether she had a moment to look at a wound presentation he wasn't sure about. She had a moment. The wound was a surgical site infection, early presentation, easily managed if caught now. She walked him through the assessment and the documentation and watched him arrive at the correct clinical decision on his own, which was the point. He thanked her in a way that had actual specificity in it, not the reflexive thanks of a handoff, but the thanks of someone who learned something, small things, the accumulation of small things. Graves texted at 4. Tavares cleared for transfer tomorrow morning. He wants to see you before we move him. She texted back, I'll come up at 6. She went up at 5:50 because she was done with her documentation early and there was no procedural reason to wait. Tavares was sitting up in the bed when she came in, genuinely sitting up, not the hospital bed recline, but upright, with the specific posture of a man who has decided he is going to conduct himself like a person rather than a patient. He had a photograph on the tray in front of him, a girl with braids and a gap in her front teeth, holding a crayon drawing of something that might have been a dog. He looked up when she came in. His color was good. His eyes were tracking clearly. He had the IV still in his right arm and the oxygen cannula gone, which told her everything she needed to know about where he was clinically. You're Solis, he said. Yes. The commander told me. He looked at her steadily. He left out a lot. He's economical. Voss told me the rest. He paused. You were in that bay before anyone asked you to be. I was in the corridor. You knew what was wrong. Yes. He looked at the photograph. He picked it up and looked at it for a moment, then set it back down. She made me a video 3 days ago, he said. She was explaining her hamster's entire personality, very detailed. He apparently has opinions about which type of bedding. He looked at Mara. I watched it in the vehicle, before we got to the hospital. She stood at the bedside. I know, she said. I want you to know that I know, he said. What that means. What you did. He said it directly, without excess, the way people say things when they mean them in full and don't want the weight diluted by additional words. You're welcome, she said. She meant that in full too. He looked at her. The commander. He talks about you differently than he talks about most people. Differently how? Carefully, he said, like he's carrying something he doesn't want to drop. She looked at the window. He should focus on getting you transferred safely. He's doing both. Tavares almost smiled. He's good at parallel processing. She checked his chart on the wall tablet, not because she needed to, clinically, but because it was the correct professional behavior and because it gave her somewhere to look that wasn't at Tavares's face, which was doing the thing faces did when they were watching you more closely than you'd authorized. She noted the discharge orders, the transfer documentation, the follow-up plan, everything in order. Thank you, she said, and she was not entirely sure whether she was saying it to him, or to the situation, or to the specific confluence of events that had put him on a stretcher outside this hospital at exactly the moment when the thing she'd been trying to leave behind had finally decided to follow her through the front door. Thank Voss, Tavares said. He carried me 2 blocks. She left him to his evening. Graves was in the hall. He fell into step beside her without announcing himself, which she was starting to recognize as simply how he moved through spaces. How is he? Ready to transfer. He looks good. He does. A pause. You submitted the account Pfeiffer requested. Last night. Duval saw it this morning. He said... He paused. He said it was exactly what was needed. He walked beside her. What time do you leave tomorrow? 0800, after the transfer clears. The meeting is at 8. I know. I'll be in the building until the transfer is confirmed. He looked at her sideways. I'll be in the building regardless. She stopped at the elevator. Graves. I know. A month. I was going to say thank you. He stopped beside her. He looked at her with the expression she'd been seeing increments of all day, the one that had been assembled gradually, over 24 hours of a situation that had stripped away the controlled professional register and left something more structural underneath. You don't have to... I do, she said. Not for intervening. I told you how I felt about that, and I meant it. She paused. For being here. For walking through that door and being the person who walked through it and making it so I had to stop pretending that part of my life was finished. She looked at the elevator button. I wasn't finished. I was just tired. He was quiet. A month, she said. I mean it. I'll be in Calverton in a month, he said. Tavares's follow-up. I know. That's convenient.
It is, she agreed, and pressed the elevator button. Friday morning arrived the way important mornings always do, looking exactly like every other morning until you were in the middle of it. Mara was at the hospital at 6:45. She went to Okafor first. He was sleeping. His son, Marcus Okafor, who was indeed 43 and who had arrived late Thursday night on a flight from Tokyo that he'd booked 40 minutes after his father called him, was in the chair beside the bed, also sleeping, in the specific collapsed posture of a man who fell asleep trying to stay awake. He was tall, like his father, with the same deliberate quality in his face that she recognized as a family feature. She checked the monitor without disturbing either of them. The rhythm had settled further overnight. The morning labs would tell the full story, but the clinical picture was good, and she stood in the quiet of the bay for a moment and watched Terence Okafor breathe and thought about the specific ordinary miracle of it. A man who had been in VFib 4 days ago, whose heart had stopped and been brought back, sleeping with his son in the chair beside him. She went downstairs. Conference room B was the same room with the same too large table. The morning light came through the single window at a different angle than it had Tuesday, which was the only thing that had changed about the room itself. What had changed was everyone in it. Pfeiffer was there.
She was seated differently than she had been Tuesday, not physically, exactly, but in the quality of her presence, something that had reconfigured between Tuesday morning and Friday. And that Mara read as the posture of a person who has been looking at documents for 48 hours and has arrived at a different understanding of her own position than the one she held at the start of the week. Duval was there. The IG investigator, whose name Mara had learned was Agent Rosario Quiñones, was there, with her portfolio and her stillness and the very specific professional neutrality that made the room feel like whatever was said in it was being weighed. Priya was there, as a witness, in the chair Mara had mentally designated for her since Tuesday. Areyas Nwoku, the interim charge nurse, was there. Mara hadn't expected that, and it registered as something. Marsh was not there. His administrative suspension had been formalized Thursday afternoon. Duval had texted her, pending the outcome of the broader investigation. His department chief position had been filled on an interim basis by a physician who had, apparently, known about the culture of the department for some time and had chosen silence, which was its own problem that the investigation would address separately. Sachs was not there either. Her situation, Mara understood without being told the details, was further along than Marsh's. The IG had more specific documentation of her direct role in the trainee removal pattern, and the meeting she'd been in Thursday had not been brief. Pfeiffer opened the meeting. She did it differently than she'd done it Tuesday. Less the neutral administrator managing a routine review, more a woman who understands that the document she's reading from was written by someone she underestimated, and that this fact is now institutional record. She outlined the agenda. She confirmed the withdrawal of the incident report. She confirmed the status of the program hold. She asked Mara to speak to her account. Mara spoke for 12 minutes. She said what she'd written, in the same order, in the same register, factual, sequenced, without editorializing. She talked about Okafor's wound and the delay in care. She talked about the pattern of non-clinical assignments. She talked about Bay 1 on Tuesday morning, what she'd assessed from the corridor, what she'd done when she was permitted to enter, what the outcome was. She talked about Petra Hollins and Dwight Caruso, whose names she had learned from a folder in a lobby 2 nights ago, and who deserved to have their names said in a room like this one. No one interrupted her. When she finished, the room was quiet for a moment. The specific quiet of people absorbing something that has been given to them accurately and without performance. Quiñones spoke next. She outlined, in the compressed professional language of the IG's office, the findings of the preliminary investigation, the pattern across 3 trainee placements, the documentation irregularities, the specific procedural violations of the program agreement. She noted that the investigation was ongoing and that additional findings would be reported through the proper channels. She noted that the program agreement's compliance provision had been activated, which meant Harlow General's placement as an approved site was under formal review. She looked at Pfeiffer. The site's status will be determined by the completion of the investigation and the institution's response to its findings, she said. That response begins here. Pfeiffer nodded. She looked at the table. She looked at Mara. I want to say something that is not part of the formal record, she said, and Duval nodded slightly, granting it. I have administered this program at this site for 3 years. In those 3 years, I processed 2 trainee withdrawals and 1 reassignment, and I treated them as administrative outcomes. I did not ask the questions I should have asked. She paused. That is not an excuse. It is an acknowledgement, and I intend to spend whatever time this site has left under review, making it an institution that veteran nurses deserve. Mara looked at her. The reinstatement process for Hollins and Caruso, she said. Duval said the oversight office can recommend it. I've already submitted the recommendation, Duval said, this morning, before the meeting. Something in Mara's chest did a thing she wasn't going to examine in this room. Thank you, she said, to the table generally, which was the safest direction. The meeting concluded at 8:52. Priya appeared beside her in the hallway outside and didn't say anything for a moment, just walked with her, which was its own form of communication. They went toward C together. The morning shift was starting. The board had patients on it, and there was work to do. How do you feel? Priya asked. Mara looked at the board. Useful, she said. Priya considered that. That's a strange answer. It's an honest one. They worked. The morning moved the way mornings do when they're full of the right kind of busy, the kind that is oriented toward something, where each task connects to the next and the connection has a human being at the center of it. Mara managed 5 patients, including a post-surgical case that needed close monitoring and an elderly woman named Dolores who was being discharged after a hip replacement and who, when Mara walked her through the discharge instructions, said unprompted, "You should be a doctor." "I'm a nurse," Mara said. "You're more than a nurse." "Being a nurse is enough." Dolores looked at her with the specific perspicacity of an 81-year-old woman who has outlived several systems of thinking about what people are worth. "Well," she said, "you're a very good one." Mara helped her into the wheelchair and walked her to the lobby. At 10:15, she went back up to Okafor. He was awake. Marcus was awake beside him, and the two of them were in the middle of what appeared to be an argument about something involving a lawn, and they stopped when she came in with the immediate guilty synchrony of people who have been caught being normal in a hospital. "Sorry," Marcus said. "He's supposed to be resting." "He's talking," Mara said. "That's better than the alternative." Marcus looked at her. He had his father's eyes, the same directness. "You're Mara." "Yes." "He talked about you, Thursday night, before I fell asleep." He paused. "He said you saw things the way they were." She looked at Okafor. "He said that to me first." Okafor had the expression of a man who is trying not to look pleased with himself. "I said what was accurate." She pulled up his morning labs on the tablet. The troponin was down to 1.4. Still elevated, but substantially improved from the peak. The rhythm overnight had been the best it had been all week. The wound on his hip was healing with the proper treatment now in place. She read through everything once, thoroughly, and then set the tablet down. "You're going to a step-down unit this afternoon," she said, "out of ICU. If the evening labs continue trending, Dr. Yuen wants to talk about a discharge plan for early next week." Okafor looked at his son. Marcus looked at the ceiling in the specific direction that means relief is too large to look at directly. "That's good news," Okafor said. "It is." He studied her. "What happens now, for you?" She thought about the question, which was different from the practical question she'd been answering for the past 4 days. "The program hold gets lifted formally when the site review concludes. I finish my placement, here, or at a different site if Harlow General loses its status. I complete the hours. I get licensed. And then? And then I'm a nurse." He was quiet. "That's it? That's what I came here to do." He looked at her with the expression she'd come to recognize as his most honest one, the one he used when he'd decided to say a thing directly and had organized himself around the saying of it. "You came here to disappear," he said, "and then something happened and you couldn't anymore." A pause. "I'm glad something happened." She looked at him. "So am I," she said, and meant it in a way that was new, not the resigned acceptance of someone who has been found out, but the genuine acknowledgement of someone who has been found. She spent 20 minutes with them. She talked with Marcus about the follow-up care plan, about what to expect in the step-down unit, about the questions to ask Dr. Yuen when she came around. He listened with the focused attention of a man who is afraid and is managing it by learning everything he can, which was recognizable. When she left, Okafor called after her. Mara. She stopped at the door. Next time you see the man with the limp, he said, tell him you said yes. She looked at him. I haven't said yes yet. You already decided. He settled back against his pillow. You just haven't told him. She left without confirming or denying it, which he would interpret correctly, and she knew it, and she was fine with that. The afternoon brought its own rhythms. Tavares was transferred at 10 in the morning. She hadn't been there for it. She'd been in the meeting, but Voss had texted her a brief, "He's out," thanks that arrived at 9:03 and that she'd read between agenda items. Graves sent nothing, which was also a form of communication, the kind that said, "I'm keeping my word." At 1 in the afternoon, a message went out to all clinical staff from the chief medical officer. She read it at the nurses' station between patients. It was 2 paragraphs, formal, institutional. The first paragraph confirmed that Dr. Elliot Marsh had been placed on administrative leave pending the conclusion of an investigation into department management practices, and that interim leadership had been established. The second paragraph stated that the hospital was cooperating fully with the Military Transition Program Oversight Office and the Inspector General's Office, and that veteran medical personnel in the transition program were valued members of the clinical team whose contributions were essential to patient care. Arayaz Nwoku read the same message from the charge station and then looked across the ward at Mara with the expression of someone who has seen this institution from a vantage point that required patience and has just watched the patients arrive at something. At 3 o'clock, Sandra from the ER appeared on Ward C. She came directly to Mara, which required some navigation because Ward C's geography wasn't Sandra's native territory. She stopped in front of Mara and said, I've been trying to find the right moment to say something, and I've decided there isn't a right moment, so I'm saying it now. Mara waited. What happened in Bay 1 on Tuesday? Sandra said. I've been in this ER for 6 years, and I've watched people move through trauma, and I know the difference between someone who knows what they're doing and someone who learned it from a textbook. She paused. I want you to know I saw it. And I want you to know I should have said something a long time before Tuesday about the way trainees are treated in this department. Her jaw tightened. Hollins worked next to me for 4 months. I liked her. I watched her leave, and I told myself it was her choice. It was made to feel like her choice, Mara said. Yes. Sandra looked at her steadily. I'm sorry I didn't say that out loud until now. Mara looked at her. At the honest discomfort in her face. Not the performed discomfort of someone going through the motions of accountability, but the real kind, the kind that costs something. You're saying it now, she said, for what it's worth. It's worth something. Sandra nodded. She went back to the ER. Mara went back to her patients. At 4:50, she finished her last chart entry of the shift, drank the coffee that had been sitting cold at her elbow for 40 minutes, and sat for a moment at the nurses' station while the ward settled into its late afternoon quiet. Priya was at the other end of the station, updating something, and they existed in the comfortable parallel silence of people who have worked hard in the same space and don't need to perform camaraderie to confirm it. She thought about Petra Hollins, who was somewhere in this country having received, or being about to receive, a letter from the Oversight Office recommending her reinstatement. She thought about what that letter would mean to someone who had written 3 lines and walked away because a system told her she had no other option. She thought about Dwight Caruso, about whom she knew only a name and a patient load, and an Army medics training, and whether reinstatement was something he still wanted or something he'd had to seal off in order to move forward. She thought about what she would do differently with the remaining 6 months. Not much, she decided. She would do more of the same things she'd been doing, the careful, cumulative, unremarkable work of being the most qualified person in the room and doing the job anyway, regardless of whether anyone gave her the title to match. The difference was that some of the bureaucratic weight had shifted. The difference was that the floor she stood on was slightly more solid than it had been a week ago, not because anything about her had changed, but because the institution around her had been forced to look at itself. At 5:15, Duval appeared at the Ward C entrance. He had his coat on, leaving. He caught her eye across the station and gave her the small nod of a man completing something and acknowledging the completion. She returned it. He left. At 5:30, she changed out of her scrubs. She stood in the locker room in the quiet, with her street clothes on and her bag in her hand, and she did the things she occasionally did at the end of a shift that had been significant. She stood still for a moment and let it be finished. Not processing it, not analyzing it, just acknowledging that it had happened and was complete and had altered the landscape in ways she wouldn't fully understand for some time. She had come to Harlow General 6 weeks ago, wanting to disappear into the ordinary. She had discovered, for what was probably the final time, that ordinary didn't want her in the way she'd been offering herself to it. The skills didn't go quiet. The instincts didn't rest. The particular configuration of knowledge and training and 9 years of working in circumstances that sharpened everything to its essential function, that didn't dissolve because she put it in a storage unit and moved across the city. It just waited. She had spent 6 weeks being handed a mop by people who looked at her and saw the shape of what they'd decided to see. And she had taken the mop every time and done the work, and kept doing the work that mattered underneath the work that was given to her, because that was the only thing she knew how to do with consistency. And in the end, the truth of what she was had not required her to announce itself. It had simply waited for the moment when it became undeniable, and then it had become undeniable, and the people who had been most invested in not seeing it had been left holding a version of events that no longer fit the facts. That was the thing nobody told you when they told you to be patient. They told you justice takes time, as if time was the only variable. What they didn't say was that you had to keep doing the work while you waited. You had to show up in the same building that disrespected you every morning and do the job correctly regardless of whether anyone was watching correctly. You had to be the thing they said you weren't, continuously, until the gap between their version and the true one became too wide to bridge. She had done that. Not because it was noble, not because she was certain it would work, because it was the only version of herself she knew how to be, and because the patients needed the correct version of her, and because Terence Okafor had been lying in a bed with a wound nobody had documented, and a call light nobody had answered, and the version of her that gave up and went home would have walked past his door. She walked out of the locker room. She walked down the Ward C corridor, past the nurses' station where a Dieze was already settling the evening shift, past the supply room, past room 114 where Okafor had been, and which was now occupied by someone new whose care was now in someone else's hands, and who deserved that care to be correct. She walked through the hospital lobby, past the chairs where Voss had been sitting with his cold coffee, past the front desk, through the sliding glass doors, and out into the November evening. The air was cold and sharp and real. She stood on the sidewalk outside Harlow General for a moment and looked at the parking lot and the street beyond it, and the city extending out in the ordinary directions that cities extend. Her phone buzzed. She expected Graves. She expected Duval. She expected a hospital notification, or a program update, or any of the dozen administrative threads that were still active and unresolved. It was a number she didn't recognize, a Calverton area code. She answered, "Is this Mara Solis?" The voice was a woman's, careful, slightly uncertain, with something underneath it that was the specific quality of a person who has rehearsed what they're going to say and is now discovering it doesn't sound the way they planned. "Yes." "My name is Petra Hollins," the woman said. "I got a call today from the oversight office. They told me about the investigation." A pause. "They told me your name." Mara stood on the sidewalk in the cold and listened. "I withdrew from the program 11 months ago," Petra said. "I want you to know I thought I didn't have a choice. I thought they made it very clear that if I fought the report, the process would take months, and at the end of it I'd probably still be removed and I'd have spent months fighting and—" She stopped. Her voice had something in it that was controlled but only just. "I believed them." "You had every reason to believe them," Mara said. "They said I could be reinstated. The oversight office." A pause. "I wanted to know if that was real." Mara looked at the street, at the ordinary Thursday evening of a city that didn't know and didn't need to know what had happened inside one of its buildings over the past 4 days. "It's real," she said. "The recommendation was filed this morning. It's in your record." A silence. "I finished my nursing degree," Petra said, "through a different program. I'm licensed." Another pause. "But I needed to know that what happened was documented, that it was real." Her voice tightened slightly. "Because for 11 months I kept wondering if I'd gotten it wrong, if I'd overreacted, if maybe they were right that I wasn't ready." "You weren't wrong," Mara said. "And you weren't the problem. The documentation says exactly what happened. It's in the record now. It doesn't go away." The silence on the other end of the line had a quality she recognized, the specific quality of someone releasing something they've been holding for a long time. The release that doesn't feel like relief exactly, because relief is too simple a word for what happens when a weight you've been carrying for 11 months is finally confirmed to have been real. "Thank you," Petra said. "You didn't need me to fix it," Mara said. "The complaint that started the investigation, someone filed that 8 months ago. The evidence was already there. I just made it visible." Still. A pause. Still. They stayed on the line for another moment. Two women who had never met and who had both stood in the same corridor and been handed the same mop and made different choices under different pressures and arrived at the same conclusion about what had been wrong, and that was its own kind of recognition. Not the dramatic public kind, not the ceremony with the applause and the speech, but the kind that happens between people who understand each other because they've been through the same thing and who don't need to explain it. Mara stayed on the sidewalk after the call ended, in the cold, with the hospital lit up behind her and the city laid out in front of her, and the specific sensation of a life that had not gone the direction she planned and had turned out to contain more than she'd allowed herself to expect. She was 32 years old. She was 6 months from a nursing license. She was standing outside a hospital that was in the middle of a reckoning she had been part of creating, not because she had set out to create it, but because she had refused every day, every time, to be less than she was. She had not fought the people who dismissed her. She had not made speeches or staged confrontations or waited for a moment of dramatic vindication. She had shown up and done the work correctly and kept her hands steady and her charts clean and her assessments accurate. And she had done that on the days when it cost her something, and on the days when it cost her more than something. And in the end, the accuracy of her work had been its own argument, and the argument had been enough. Nobody tells you that. They tell you to fight, to push back, to make yourself loud, to refuse to be invisible. And sometimes that is the right instruction. But sometimes the most devastating thing you can do to a system that has decided you are nothing is to keep being exactly what you are, correctly and consistently, until the gap between what they've said and what is true becomes impossible to maintain. She put her phone in her pocket. She pulled her jacket tighter against the cold. She walked to her car. She drove home through the ordinary streets of Calverton, and the city looked the same as it always looked, and nothing about it announced what had changed, and that was fine, because the change that mattered was not the kind that required announcement. She had come here to disappear. She had discovered, for the last time, that she didn't know how. And standing on the other side of that discovery, in the cold November dark, with a licensing exam in 6 months, and a man who was going to ask her something in a month, and an old veteran in a step-down unit whose son had finally arrived, and a woman on the phone who had carried something wrong for 11 months and had just been told she hadn't been wrong. Standing inside all of that, she understood that what she'd been trying to leave behind was not the work. It was the cost of doing the work without being seen, and that cost had finally, imperfectly, belatedly, been paid. Not by a ceremony, not by applause, not by a speech or a plaque, or a moment where everyone in a room rose to their feet. By a federal investigation and a withdrawn incident report and a phone call from a stranger who said thank you in a voice that meant something larger than the words. And by an old man with an irregular heart who had looked at her on the first day and seen what she was before anyone else in the building had bothered to look. That was enough. That was, she thought, driving home through the dark. Exactly enough. And she had learned, over 32 years of being the kind of person who shows up regardless, that exactly enough was not a small thing. It was, in fact, everything.